as well. We've been distributing food boxes over the last 2 months to our most vulnerable members that we serve. And those are drop ship boxes with a partnership with Walmart and Kroger, where our case managers and our staff out in the field identify an individual who has need for food, and then we have a 2-week supply of food drop shipped to those individuals. The third program, and specifically this is the program I'd like to discuss today with the council, is what we're calling our Health Disparities Initiative. And again, based on the fact that minority populations have been disproportionately impacted by COVID. And we've identified 4 areas where we would like to support, 4 areas that were identified as 1, COVID hotspots, and 2, overlaid with areas that have high social determinant of health needs. And those 4 areas were Philadelphia, Los Angeles County, Orleans Parish in New Orleans, and the Navajo Nation. And the program consists of 4 elements, and we are in the process of bringing this program up specifically in today, Philadelphia and Orleans Parish. We should have those programs up and running within the next 2 weeks. But the program consists of 4 elements: testing and follow-up, culturally sensitive education, safety kits, and food. The goal here is to reduce the infection rate in these targeted areas and reduce the death rate in these targeted areas. And so we would start with testing. We would provide a total of up to 8,000 tests over a period of 60 days with mobile testing units dispersed across the nation. Those would be provided, those would be coordinated by our sister company, OptumServe. And as individuals show up to get tested, we would provide them culturally sensitive education, the need or the importance around social distancing, the importance of wearing cloth masks and sanitizing and so forth. We'd provide everyone a safety kit, which would include a non-clinical mask, sanitizer, and then everyone would get either a food box or a food voucher. But again, this is the program that we would like to bring to bear: 8,000 tests over a 60-day period. But of course, we understand the challenges of the nation, the geography, the lack of running water, et cetera. The chapters presented across that diverse geography, the residents presented across that diverse geography. This model obviously would have to be tweaked and adjusted to support that. We would have to bring mobile testing sites out to multiple areas to impact or to address the transportation challenges and so forth. And we are prepared to do that. Now, I said, so 60 days, 8,000 tests, education, food boxes again for the 8,000, and safety kits for the 8,000 individuals that we would test. And we would do this as part of our health disparities program. We would ask for no reimbursement of any kind. This is what we want to do to help. Again, so that is we have this program about ready to kick off in 2 of those 4 areas, and we hope to be able to partner and bring this program or a version of this program or perhaps something else to help support the nation during this time. And as I said, I spent a few minutes talking about the resources we can bear, the program we have in place, but now it's time for us to listen. We'd like to get your reactions, thoughts, and hopefully we can come to an agreement where we can move forward, at least with this initial part around the 8,000 tests. But at this point, we're here to listen and answer any questions you may have. So, Speaker Damon, I turn it back over to you.
Answer, does that conclude your presentation?
We do have one other area that we can talk about and it's part of the 3 slides that we distributed, and it is telehealth capabilities as well. And if it's okay with you, Mr. Speaker, I'd like to have Dr. Steve Chekmakian just spend a few minutes on that particular capability that we can bring to bear. If that's okay.
Okay. Did you have a PowerPoint presentation to attach to that, or?
We did have a 3-slide presentation, and I believe it was sent over. Mr. Begay, Carlisle Begay. Did the presentation get sent over?
I need to get some forward. Get some more chicken feed, I guess.
So, Speaker, we believe that the presentation was sent over, and basically I covered the first 2 slides of the presentation with my talk. We can make sure you get that, and we apologize if you didn't, if the delegates did not get that, but we can make sure you can get that after we're done here today. So, Steve, if you want to spend a few minutes on the telehealth capabilities, and then we can go to questions and reactions.
Okay.
Yes, thank you. Thank you, Joe, and thank you, Speaker Damon. I'll be brief. First, I wanted to mention that with regards to what I was preparing to say, and in regards to what Joe Gaudio just said, we understand that the Council is assessing and evaluating several streams of funding, and in that developing plans and approaches that would take the greatest advantage of those funds. And so to the degree that United Healthcare could be of assistance, we know and hope that the conversation could be how could these opportunities best complement and support the solutions that are being orchestrated throughout the nation with those fundings and what's being discussed. And one of the other areas that we felt might be of interest, and it may be an area of opportunity for partnership or collaboration, would be around telehealth. We understand that there is telehealth capabilities and some capacity in the Navajo Nation. However, with our resources and some of the technology and supports we might be able to offer, we had hoped that accelerating the use of telehealth, not only during the period of the COVID crisis and how that may be of assistance, but then in a longer term fashion and format, how that might help to improve or support the overall health and well-being of citizens on the nation, was another area of opportunity we thought could be explored. And briefly, our goal would be, as Joe mentioned, to listen and understand where there may be gaps or limitations in the current capacity of telehealth services, identify if there's a way for us to help those specific populations or areas of the nation, and then work together to deploy some type of intervention that helps meet those specific areas or needs. And then, over time, learn from that experience together and determine if there's additional opportunities in the future to further support remote and telehealth services for the nation. Thank you.
Okay, all right.
Colleagues, having a lot of conversations in the background. Can you please mute your phones? Our staff members, everybody that's online, please remember to mute your phones. Will that conclude the presentation from United Way or United Health?
Yes, Speaker Damon, that concludes the presentation. And at this point, we'd love to entertain questions, get thoughts, feedback, reactions, and hopefully agree on a plan for next steps if the nation is interested in partnering with United Healthcare.
Speaker.
Okay. Honorable Elmer Begay, go ahead, and then I have Honorable Nate.
Speaker Thomas Walker, though.
Oh. Naabik'iyati, Thomas Walker. Okay, go ahead, Honorable Elmer Begay. Floor is yours.
Hey, good morning, Speaker Damon. Thank you for this this morning's presentation. And the people, I didn't really get the name from all of them, all those with the United Health Care. But my question is directly goes to the organization right now, since it's a health organization. My question is right now, the experience that we have and that I found out today or yesterday too is that we have Navajo people that are being taken to Winslow Indian Healthcare Center from here. It's a 638 hospital. So when we take them over there, there's some people that are being diagnosed with pneumonia, which is like the old-fashioned, you say that it's a bacterial one, where they got being diagnosed with that pneumonia. So they cannot be. They're elderly. They cannot be there overnight. So they have to take it down to a private hospital or Memorial Hospital, which is Winslow, which is Little Colorado Medical Center there. When they're taken in there, I guess they just put them into a room with a person that are COVID-19, and we found out that yesterday. So I start calling around saying that, hey, who do I need to talk to? Who's the one that did this? And what's the procedures? What is it? What's the hospital procedures? You know, that being thinking that the medical center or the where they could save lives. Things like, it's not like that. So right now I'm beginning to find out that if it's Native American or if it's elderly, if it's come from the reservation, if they're not even they've been tested negative at the Winslow Healthcare Center, taken to Memorial Hospital, they put these people into the same room as the COVID-19 positive people. So I'm making a complaint right now, which I don't know how many of Navajo people have been treated like that. So I'm really I'm frustrated and I don't know who to talk to. So through your organization, if you're coming up with another organization, this is what I always stand is for the people. I thought that the hospital are very knows who calls the shot, who makes those decisions. You know that who in the hospital in that hospital setting. You know that so right now it's not good to me. You know that thinking about my people been taken over there, they never came back out, or they've been taken back home, and the spreading is over here again on the reservation. If they're being released it before, if they're still negative, but they're still been exposed to this COVID-19. So I'm very concerned right now. So I don't feel good today. You know that my people, you know that I thought that they'll be saved, but it's not. We're beginning to find out that why or the spreading of this COVID-19 disease on the reservation is still spreading, and we just blame the people. But right now, I'm blaming the healthcare centers. So if there's a complaint like this, how would I get to that person or the point to say, hey, time out. You know, we need to stop this. We need to reorganize this. We need to get to this point. And something like that, though, that's what I'm thinking. So through your organization, how if there's a complaint like this, how can it be handled? That's my question, Speaker. Thank you.
Thank you, Delegate, for that question. This is Joe Gaudio. So if you think about the program that we'd be able to bring to the table around testing 8,000 individuals, it's not just testing and it's not just food, it's not just the education and the safety kits and so forth. For those individuals that would test positive, there would be follow-up to that, that we would help coordinate. There has to, if you think about contact tracing and those other elements that are needed in order to contain the virus and stop the spread and reduce infection rate and prevent death. That would also be something that we would help coordinate, which would be if an individual's test positive, it would be contact with that individual, identifying who else that individual has come in contact with, supporting contact tracing, et cetera, so that appropriate measures can be taken. As we all know, that is a key to containing this virus. And of course, we would also be working on coordinating with that individual's primary care physician or where they would seek primary care, whether it's an IHS facility, a 638 facility, or some other facility. There would be contact there as well so that the appropriate medical professionals understand so that we can help contain. Exactly what happens in the hospital, I can't speak to that. However, as part of this coordination effort, that would be something that, we could look into. We would have contacts there, obviously, that could handle those types of concerns. And then, we would use our avenues in relationships to speak with these hospitals in question to ensure that the members that are being referred over to these facilities, that the appropriate care is being taken, the connection is being made with local primary care, and that we're not further putting these individuals in danger by rooming them with somebody who is COVID positive, and this would be somebody who's not, but presenting with pneumonia or some other symptom. I mean, we could help coordinate and follow up with these systems as part of what we do to ensure that the Navajo people and the right measures are being taken place in these facilities. Steve, Dr. Chakmak, anything to add on that?
No, thank you, Joe. I think what you said is about as accurate, as it could be. Maybe just add that, as you know, because we're a healthcare organization and a health plan, particularly one that has been working and serving individuals in Arizona for about 30 years, we have had the opportunity to develop relationships with hospitals across the state, and I think as well as to develop processes to look into potential quality concerns for the individuals we're privileged to serve. And so all of the things that Joe just mentioned, I would say, are part and parcel to activities we undertake every day on behalf of individuals that we help provide healthcare services to. And in such an instance like the one you laid out, we would want to coordinate with all of the types of individuals Joe just referenced to better ensure that the utmost quality of care is being taken while trying to address the needs of that individual as well as the needs of the others in that facility setting.
Great. Thank you for that response. Let me go ahead and move on down.
Thank you.
To Honorable Keelan Begay.
Speaker, good morning. This is Delegate Keelan Begay. I represent 5 chapters in the central part of the Navajo Nation. My chapter surrounds the community of Chinle. Majority of my chapters that I represent are in the most remote area of the Navajo Nation, and I would say several 30-40% of the community don't even have running water or electricity, if not telecommunication. So while you offer this particular services, I believe that majority of our community will suffer. And I've been lauding this particular issue to the Navajo Nation government at the beginning of my term, and especially the beginning during the Navajo Nation declared the emergency on the COVID-19. But the one area that I see your presentation as a proposal, the model and framework proposal for the Navajo Nation. I guess the key question is that should the Navajo Nation Council agrees to partner, what's the immediate time that your company or your organization will be on site on the Navajo Nation? So that's one question. Now, the Navajo Nation, the state of Arizona had, through, I guess, the leadership of the governor, has been doing testing. He calls it testing blitz across the state of Arizona. The Navajo Nation Incident Command Center utilizes Form 213 to inquire and request for certain resource pertaining to COVID-19 at the local level. So the one area that I've been pressing for answer, and if the Navajo Nation could coordinate, is testing across the community. We call them local chapter. We have 110 communities. What's the possibility that your company can provide testing blitz at all 110 chapters? That's the second question. What specific do you have for veterans, elders, and youth? Specific resource for these particular group, the veterans, elderly, and the youth. And then there's the next one is the distribution. You've additional supports for basic need, aim, economic disruption. I know you've probably seen and heard, seen the president's office continues to do distributions of a box of food. But I believe that the nation will like to see distributions specifically for preventive products. Maybe that's an area that some of our Navajo people would need to have additional more availability of distribution for preventive, because majority, like I indicated, majority of our Navajo people don't have running water. So what preventive recommendation would you have for those Navajo people who don't have running water at home? Now, the other area that's most concerned to me, and that was the latest Form 213 that I've submitted to the Incident Command Center, and I talked about this to the IHS area director, and I believe this is my personal belief. I believe that the number increase is due to releasing the positive individual back to the community. The Navajo Nation doesn't have specific location, and especially if these people are waiting for the testing results. So that's one area. Could your group or your organization set up a location where individuals would be isolating or quarantine for several days? So maybe that's another area that the Navajo Nation would request. But I would have assumed that the Navajo Nation receiving certain CARES Act funding, that the nation was up and ready, spending all it can to get these particular resources up and running at each of the community. But as we speak, we continue to get, requests or get updated information from our community members, or even get requesting for information of what they need to do. Because I've forwarded a lot of phone numbers to the ISS director, people asking, now we've quarantined at our home. Do we need to go into cleaning our house? Is there a service that we need to clean down our house where we've quarantined and where we've isolated ourselves? Because next thing you know, the individual have came out, but yet the family members will come back into the house and maybe go back to the whole cycle again. So those are the main things that I believe that the Navajo Nation will be looking out and see if that particular area will be of service by your organization. So that will be my question, speakers. Thank you.
Thank you for the question. I'm sorry, Speaker.
No, go ahead. Go ahead.
Yeah. No, thank you for the questions. Those are obviously very relevant questions. So let me tackle them one by one. And if I missed one, please remind me. But I believe I've written them all down. So first and foremost, regarding timing, obviously our goal would be to be on site and up and running as soon as possible. Now, I'm not going to say tomorrow. I'm not going to say next week because there's a fair amount of logistic work that has to take place, particularly as we think about the challenges on the nation and the 110 chapters and the vast distances. We would more than likely need to set up mobile testing sites within these chapters and probably rotate over the course of 60 days so that we've got coverage. Those logistics take time. And, a key next step here would be to meet with the right representatives, from the nation, the probably health departments, chapter representatives, et cetera, so that we can work through these logistics so that we can at least bring those initial resources to bear as soon as possible. Is that 2 weeks? Is that 3 weeks? Hard for me to say at the moment, but I would tell you that we would be committed to bringing the resources as fast as we can, but there are logistics that we do have to work out. Now, excellent question regarding testing across the nation, because it is my understanding that there is a need or a desire to test all 165,000 Navajo residents. This is certainly something where United Healthcare and our sister company, Optum Serve, could help come in and scale. Now, the first 8,000 tests over the period of 60 days, there would be no charge for that. That is part of our health disparities program. It's fully funded by United Healthcare. To go beyond that, we can scale, but we would need to come to a financial agreement because we will need funding for that in order to scale that. Now, included with that, we would need to hire individuals to help organize these sites, distribute the food boxes or the vouchers, or hand out the education materials, contract tracing, that type of thing. And our desire would be, from an economic development perspective, would be to hire local residents, local Navajos, to help fulfill the staffing needs. And obviously that will take some time as well. But the point is with our size and scale, we can do that. We serve, as I mentioned earlier, 6.3 million, and that's just the Medicaid lives across the country. We probably 20 million Medicare and probably something similar on the commercial side. We have size and scale. We can do this. It will take some time, but we can do it. But again, above the initial 8,000 tests in the initial program, we would have to come to a funding agreement with you. But we are in the position where we can coordinate and bring those resources to bear, and in addition, utilize and hire local Navajo resources to help do that. Now, another question around veterans, elders, and youth. As I mentioned, we serve veterans and elders and youth across the country through all three of our main insurance products, Medicaid products, Medicare, and commercial. And we have, specifically speaking from the Medicaid side of the house, Medicaid population primarily consists of the age blind and disabled and youth, so primarily elders and youth. Plus, in Arizona, we do have the expansion population, so we do have older adults in there as well, and veterans. And we have a veteran liaison where we look to help specifically address and design programs to help us engage veterans so that they get, they have coverage by United Healthcare. They're our member, but we need to engage them. We need to find them, and so that they are getting the preventive health they need and so forth. Point is we have a tremendous amount of experience dealing with youth, elders, and veterans, and even to the point where we've got, in addition to a tribal liaison, we have a veteran liaison and so forth. On the distribution side, I mentioned earlier that we have the relationships with Walmart and Kroger that allowed us to do this food distribution program, where we were able to work with those representatives, work through their supply chain, and get them to source and pack and ship food boxes for individuals that we brought to their attention. We have the relationships and the scale to bring those resources to bear. Of course, there's costs associated with that, but point is we've done it. We've done it nationally. We've been doing it over the last 6 weeks, and that is certainly something that we could look into in terms of perhaps enhancing that safety kit, putting more preventive items in there, and look to our partners at Walmart and Kroger and see if they're in a position to help bring in their vast supply chain expertise and so forth to bear. In addition, if we want to get a little more local, St. Mary's Food Bank. We are a strong supporter of St. Mary's Food Bank, and I understand they have been a key partner here serving the nation through this crisis. We have sponsored a mobile food pantry that they just brought online not too long ago, and this is a refrigerated mobile food pantry where fresh produce and so forth can be stored, displayed, and transported and brought to various sites. We also worked with the Arizona, I think it's Food Association. I can't, the name evades me at the moment, but we provided funding for 3 refrigerated trucks, semi-trailers, and the goal there was to go down to southern Arizona, pick up fresh produce from the Yuma area and so forth, and distribute that, across the state, because access to fresh produce obviously is an issue. Again, point is we have developed these programs and we have developed them at scale, and we have relationships. Quarantine locations. I was glad you asked that question. United Healthcare has been asked by the state of New Jersey, as you know, another COVID hotspot, to set up and run field hospitals. And we have basically loaned the state of New Jersey several key executives, Dr. Jeffrey Brenner specifically, who has been one of the pioneers actually in addressing social determinants of health and linking it to health outcomes by addressing social determinants, but an expert in that field. He is currently overseeing and managing those field hospitals. And they're not just field hospitals. I think we do have quarantine locations in there, if I'm not mistaken. Again, the point is we've got expertise that can do those types of things, of course, with the appropriate funding and so forth. If I had to summarize my answer in one very short and simple phrase, it's United Healthcare is part of a very large organization, United Health Group, which consists of 2 main divisions, United Healthcare and Optum. We are a Fortune 7 company with vast resources, knowledge, expertise, capabilities, relationships and contacts at the national, state, local level that we bring to bear in everything that we do. All the products and members that we serve, we have the capabilities to scale. We have the expertise to listen first and then figure it out. Because as I mentioned earlier, there are unique challenges in the nation. And And we want to work with you to help figure out how we can address those challenges, but we have the capabilities and the expertise to scale. Steve, anything that you might want to add to that answer?
It was extremely thorough, Joe. I would just maybe add two brief things. One, that amongst those individuals that we have who work with us, whether it's around veterans affairs, helping to support and treat the aged, or also youth-based programs, I was thinking about all of them as you spoke, Joe, and I think that given the opportunity, which I hope will happen, to be able to partner and work with the nation on some of these areas, I feel like it's also a tremendous opportunity to learn, not only just during the COVID crisis, of course, but to learn better how we can collaborate on care, as we have been trying to do for years, how we can better collaborate in culturally appropriate and collaborative care with the Navajo Nation. A number of individuals from the nation choose our health plan from time to time, right, when they're not receiving services from Indian Health Services or local centers, care centers. So I just think it presents also a longer-term opportunity to learn and to grow together. And then I was thinking that you mentioned Dr. Jeffrey Brenner, but Dr. Anna Fuentevilla, who would have loved to have been on with us today, she's the Chief Medical Officer for Optum, that other half of the division, the company that Joe referred to. She's actually on her way, actually there now, actually in Shiprock, New Mexico for a week, where her and her husband are going to directly serve from both, I think, helping to assist in the command center approaches, but also in the direct physical healthcare provision. And Dr. Fuentevilla is going to be involved. So I just bring it up because I think it's another opportunity in which we're able. Thanks, Joe.
Hello? Hello?
Yes, hello. Yeah, you're here.
I'm
Your
here.
son was here. We're here.
Okay. So
Okay.
unless there's a follow-up to that response, Mr. Speaker, I turn it back over to you for other questions.
Okay, great. Great. Vice Chair Walker.
Yes, Speaker, staff, and colleagues, members of the Naabik'iyati Committee, the presenters, United Healthcare of Arizona, appreciate you coming on this call this morning to give us the presentation, very, very important information and very thoughtful exchange of information through questions and so forth. I appreciate that. I want to say that I represent communities that are out here in the southwest portion of the Navajo Nation. So that's Loop, Tulane Lake, Bird Springs, Cameron, and coal mine chapters. So my constituents and local leaders have been asking testing, COVID testing. And of course, we, as a delegate, I communicate this with Indian Health Services and Navajo Nation, and of course the Incident Command Center, as well as the Office of the Speaker. So I've done that a couple of weeks ago, Mr. Speaker and colleagues. So the letter that I sent, listing all that I've mentioned here, but there's not been a response, Mr. Speaker. So that's one example of how there may be disconnections, or there are too many moving parts and everyone's trying to play catch up, or everyone's trying to address everything all at once. So there seems to be some question of organization there, but that's internal. And as a delegate, of course, we want to voice our concerns and address the needs of our community today, not a couple of weeks later, but today. So what I'm hearing today is
something that's from the private sector, and that it seems like we can get some results. We can get some support and assistance today, and that's the difference between government and non-government approaches to something this big. So we all need to partner up. I think in the government sector, private sector, local communities, we all have a role we could play in addressing this pandemic. So these are dangerous times as I listen and hear my leadership here this morning, and they use words like "bahatzit," you know, and they say that it spells out to be very extremely concerning life and death situations, and that brings fear, anxiety, and so forth. I have to stand on the fact that we will keep trying, we will keep addressing, we will seek out partners, even in the private sector. I would say that to my leaders here. We are a tribe that who relies on federal government for health care, education, public safety, and you name it. Today, we must also reach beyond that and try to partner up or try to connect private sector and government to work together to be able to serve our people, our dear people. So, dear people, I have to say that is that the help they're looking for is whether it's government or non-government, whether it's local or from a distance, that is the same. The help is the same. The intent behind it is the same. So it doesn't matter whose resources are being utilized, who's contributing. That help that they're receiving in is the same. I want to stress that point. Sometimes I feel that, because earlier we had a small round of discussion on who's not on the call and who's invited and who's not coming on the call for whatever reason. That kind of scenario just tells me we have a long ways to go in trying to partner up and trying to work together. And this complicated scenario, a very dangerous scenario. It almost seems like there's no room for mistakes, no room for gaps in communications. Normally I don't sound like this, but I am very concerned, and I have to find the words to try to convey that represent the feelings and concerns of my constituents out here. So number one, we're asking for testing resources at our locale, and regardless of who's going to supply and pay. Well, we're the government that can make that happen. We're the leadership that can bring about such resources to our people. So we will try, whether it's with United Health or other county, other providers in the area, we will keep trying. Queenston, my leaders, with respect and understanding, we have to communicate. And the other is the resources that we seek. Just let you know that I will again follow up with the letter to the leadership, to our agencies, and to the Emergency Command Center, seeking testing again for the second, third week. So appreciate the discussion here. The offer for help sounds, I would welcome that. The audience here, I appreciate the call here. And as I could see from our standpoint, our vantage point is that the testing that's being conducted, it's not uniform. And I think our nation, our Health Command Center, and our entities that are charged with overseeing healthcare or even regulating healthcare, they're responding to, say, like the hot spots. And although our area is not that, and we are concerned that we don't want to be a hot spot. So to think about that, I think by responding to these critical need areas, that we seem to concentrate a lot on these areas, and that's okay, that's needed. But we need to look after all our people also, and by providing opportunities to get testing and then to conduct effective. I got to emphasize on effective contract tracing. And I'm not saying that what's being done is not that. I'm just saying, okay, with an emphasis on effective contract tracing efforts for the Navajo people out here. That seems to be we've got to stress that. Lastly, I want to say also, these could be taken as questions or comments. But lastly, I want to say that the United Healthcare Arizona, if you can respond to this, it would help me also. And I know it would help leadership. The treatment drugs to COVID-19, whatever's available now in the country or in the world, treatment drugs. What is that like? We see a lot of information in the media, social media. When there are too many opinions on that subject, then it's just sometimes your guess or your understanding. So treatment drugs, and my leaders also, Mr. Speaker, the minute that there's effective treatment. Effective treatment drugs. Yeah.
Wait, Shawaka, hold on real quick. Honorable Halona. Honorable Halona, can you mute your phone? Colleagues, can you mute your phones? Vice Chair Walker has the floor. Thank you. Vice Chair Walker, go ahead.
We can hear you order hamburger.
Okay, so when treatment drugs and of course the vaccine becoming available, our people should be at the front of the line to receive such medication. And for a long time, Navajo, other natives, minority groups, for some reason, the disparities are there, certainly. There's a lot of truth to that we find ourselves in the back of the lines. So even I want to say that's my thought this morning. I want to share that. And again, thank you for this time, Speaker.
Thank you, Vice Chair Walker, for those concerns and questions and recommendations too as well. I don't know if anybody from the presenters want to tackle or start tackling some of those questions.
I think so. This is Joe. I'm going to have to. I'm going to ask Dr. Chuck Makian to weigh in on United Healthcare's. If I understood the concern / question was our perspective on treatment drugs. Dr. Chuck Makian, anything to add or share around, how we are approaching or what our current thoughts are around possible treatment drugs?
Thanks, Joe. Yeah, that is one of the $1 million questions right now. And I'm not sure, Delegate, but to your point, the information that we read frankly, in the news is oftentimes some of the most current. I will say that from what I've read and what our clinical leadership have shared and advised, and of the national and international speakers I've had the opportunity to listen to, the main medication that appears to show some benefit, it would appear, at reducing either the length of infection and or potentially the severity of infection is the drug called remdesivir, which is a antiviral medication, which you may have read about, has been granted extended and more rapid approval for use and testing during the COVID-19 crisis. A number of the other medications which have been referred to in the press or in releases, from my perspective clinically, do not yet appear to show really clear evidence of how and in what way they will be helpful, or if they will be at all, or if they'll ultimately be determined to be potentially harmful. So I think that the facts on that are still out. You mentioned vaccination. Of course, there are a number of companies at this point that appear, according to news releases, to be making relatively active and proactive progress on production of a vaccine. I think ultimately the question around the vaccine effectiveness will come, as well as safety, will come down to the time that we have for adequate testing of it around the safety. And then ultimately the effectiveness is one of the major questions that folks have, with the knowledge that the vaccines we have for other viruses range in effectiveness depending upon how the individual virus that the vaccine is intended to help prevent, how that virus reacts on a year-to-year or seasonal basis. How much does it change and how much does it stay the same, such that the effectiveness of the vaccine can be more highly predicted over time. So a couple of comments on the medications and on the vaccinations. And with regard to distribution and the potential inequity of distribution, that is understood. I think that is one of the reasons why, as Joe pointed out, we are here to listen, not only in response to the things that, the ideas that we're proposing, but then to talk about whether there are longer term ways in which we can collaborate over time, hopefully past the more immediate COVID-19 crisis and into a period where prevention and or treatment might be an area in which United Health Group could offer or lend some additional areas of support, again, in close collaboration with the healthcare partners that already provide services to citizens of the nation. Thanks, Joe.
Mr. Speaker?
Thank you. Does that conclude your response?
Yes.
Okay, great. Let me move on down to Honorable Brown. This is my lineup that I have here, colleagues. I have Honorable Brown, Honorable Stewart, and then Honorable Atoso. Honorable Brown, floor is yours.
Thank you, Speaker. Based on 24th Navajo Nation Council and United Healthcare, thank you for your presentation. First of all, I just wanted to thank you all, and I do appreciate the olive branch that you're reaching out to the Navajo Nation and to our people. So, and then for your test kits, and then also the contact tracing. I'll leave the politics out of this, and I would like to invite you to KN to IHS, and we'll deal with the politics over here. But with United Healthcare, I just want to invite you, and I'm now talking to our KN to IHS CEO, Ms. Minerva Plummer, and we will be setting up the station as soon as those test kits are delivered. So I did ask her about the manpower at Kayenta. So we are talking about that. We also have the Doctors Without Borders. I did meet with them last week, and they are providing the educational part of that. And they'll be also doing contact tracing. I'm also organizing with another organization, and really, I'm sure you understand the burn rate of the testing kits, the burn rate on a lot of the hand sanitizers and everything that's keeping every one of us safe. So I do appreciate the face masks and other supplies that you're offering to our people. Thank you for that. And we can set up something at the Kayenta IHS. We are working on that. Of all the testing blitz that are going on around Navajo, we have not had one in Kayenta. Again, it's still people with symptoms, but again, this is Nathaniel Brown. I represent Chilchimbito, Denahutso, and Kayenta communities. And with the Kayenta IHS, we had the first cases. And even though we're a mid-sized clinic, our numbers are still climbing. And really, our people are not, they don't know the status, whether they're positive or not. Well, especially with positive asymptomatic individuals who are still traveling, visiting families, delivering food. Maybe some of them are back in the workforce. Like I now no longer eat anywhere outside my house right now because I don't know what a Taco Bell worker, Blue Coffee Pot worker, what their status might be. Unless if I know their status, what Utah is doing, I do appreciate that they're testing everyone before they go back to work so they know the status, that they're fully aware and educated. And that's another thing that I would like to reach out to you and offer our help with my team that are the boots on the ground. We've done all the trainings, the Series 100 and 700. And we also have a meeting with our team, the Kayenta Incident Command Post. And we have been retraining, and my boots on the ground are actually, they have been tested also. So we know everyone's status. They're required to get, in order for them to continue to volunteer. So that's something that we're doing. So I want to offer my assistance and how we can make this happen. I understand that you're coming to the nation, you're coming to us and offering your support, your help to the nation. So I want to take that, and I do have my team ready for you, and we can go on another call. And then this is another thing, we'll try not to make this political, but my suggestion is not to donate this to the Navajo Nation Incident Command Post because there is a bottleneck there out of the 110 chapters. And not all the supplies are getting filtered to where it's needed. So again, I'm here with my team, and we are going to make ourselves available on when you can bring those test kits. The earlier, the better. It seems like on average for the past couple of weeks, we have been burying about three of our community members every day in each community. So last week we had 4 in Denahutso, 3 in Chilchimbito, 3 in Kayenta. This morning I got another text that we lost another relative of ours that I know very well. So it's like we as delegates, we constantly get these texts. It's heartbreaking, but I will stand here and be here. I will work with anyone that I can. I think we just need to come together. So thank you. I appreciate you coming to the nation and for your presentation. So I will share my contact with Mr. Carlisle Begay, and he can forward my information to you, and we can start talking after this call ends. Thank you.
Thank you so much, Delegate Brown. And first off, my deepest sympathies to all those that have lost loved ones on the nation and across the country. This is just it's a very difficult and challenging situation, and I can't imagine what it's like to be receiving those tests on a daily basis on, constituents that have died within the local chapters, many who you know, I can't even begin to know what that feels like. And so my deepest sympathies on behalf of myself and United Healthcare. Thank you for your offer to support. I think you've raised really a critical element here is that it's going to take a community. It's going to take multiple communities. It's going to take partnership, collaboration, communication, but it's going to take the entire communities coming together to address these concerns, which, you know, the testing and the contact tracing, but on a broad scale. And it's going to require, you know, local chapters, support, and contacts, and so forth. And those are what we're going to have to, you know, we can bring the resources to bear, but we need the local support in order to make it truly successful. And I appreciate you raising that and bringing that to our attention. Thank you. Steve, anything you might want to add?
No, thank you, Joe. You said it eloquently. Thanks.
Great.
Mr. Speaker?
Okay, great. Let me go ahead and move on down to Honorable Stewart. The floor is yours.
Okay, thank you, Chairman. Also, thank you, presenters, for your presentation on the testing. I just wanted to ask a couple of questions and also give some comments to your presentation. I was contacted over the weekend by another group of individuals that were wanting to do the same thing, and they stated that they were in White River at the same time as well, doing the same type of testing. But they also are working within Operation Peace Project, and they wanted to know if they could do the same thing through Navajo. And I was waiting for a write-up from them, but I haven't gotten anything to present back to our speaker and also to the rest of my colleagues. This one here, they also wanted to do pretty much the same thing that you are requesting to do. The only other question I have is one, why are these tests? I know that it's needed. I know that our people need it. I know that we as delegates were asking for testing to be done. And we also hear of expiration dates and whatnot with the tests. We also hear, not tests, but with other items that come to the nation. And also, you know, through these testings that are going to be done, you know, is that going to, you stated before that there's no cost to the test, if I'm not mistaken. And then also, you know, that you are working with another group, another entity. And that's what I wanted to find out, because this group here was working with the Naabik'iyati Medical Center and also working with other partners that they have, from physicians to specialists to scientists, and also working with different medical supply vendors and equipment vendors as well. And is that the same type of deal you're working on? And then their main priority is working with Native country. Is that your priority through the state of Arizona? Working with Native country as well. Those are just what I want to ask. And that's it, Chair.
Thank you, Honorable Stewart. Hold on real quick. Colleagues, again, if you could please put your phones on mute. Thank you very much. Go ahead.
Thank you, Delegate Stewart, for the question. And just if I may, the initial proposal, which again we will have to more than likely, you know, adjust and refine as we think about how we're going to address the distances and so forth. But we can do that. We can come up with a solution for that. It is 8,000 tests over 60 days, and that would be at no charge. To scale beyond 8,000 tests, and we are prepared to offer a solution there. To go above and beyond the 8,000 tests, we will need to come to a financial arrangement because we will need funding for that. If you think about the scale that's going to be involved and the amount of people. And as I mentioned earlier, there would be an opportunity to hire local Navajo residents to help with this. But the plan would be, a mobile test, probably rotating, multiple mobile tests rotating through the various chapters to test, the ultimate goal of testing all 165,000 Navajos over a period of time, and then the follow-up contact tracing and so forth. But it is, I'm not familiar with this other organization that you're referring to, and I'm sure they do great work. But what I can tell you, what will separate United Healthcare is our scale, our ability to scale, I should say, the resources and technical expertise that we can bring to bear, our size, relationships with various vendors and so forth. And yes, our solution would include the testing kits and the materials and things of that nature that are needed in order to support, whether it's 8,000 tests or if we go above that and 20, 30,000 tests. Now, mind you, quite a logistics that would need to be figured out, but that would be our intention. And it's also apparent to me that there's another opportunity here. Again, it's going to take, as I said, it's going to take partnership and cooperation, and open communication and trust from multiple entities. And to me, it seems like there's an opportunity to help coordinate all of these entities. One option could be, United Healthcare comes forward with a solution, says here's what's needed, and here's how it would work, and we can test, X number of, let's just say 165,000, just for argument's sake. Or another option would be we can directly test X, and then we would help coordinate with the other organizations that you are currently doing testing with to ensure that this process is coordinated, this process is efficient, that contact tracing is taking place, the right referrals are being made, et cetera. It sounds like there might be an opportunity to serve, not only provide direct testing and so forth, but also serve in a coordination type role. But that is something else, that's another area that we'd be very interested in. Again, a lot of this, all of these things are going to take discussions so that we can, scope out and again, better understand, better learn so that we can put forth a very efficient and viable solution, whether it's just the 8,000 or we want to go above that. But we will need to meet, my recommended next step is if the council favors moving forward, is to get our teams together, the right individuals and resources from the nation, and of course our teams, so we can have these initial conversations to scope out in more detail what's needed, what can be done, so that we can be more informed, so that we can come back with a proposal sooner rather than later and move forward with this quickly. Dr. Chikmakian, anything to add?
Yeah, thank you, and thanks, Joe and Delegate Stewart. And I agree. And I think that, like you said, Joe, we're not sure which organization Delegate Stewart was referring to. I suspect, and we've heard that there are a number of very well-intentioned organizations that want to help for all the right reasons, including us. So that's completely understandable. And I think the objective would hopefully be to work with you to understand which of those materialize and try not to overlap efforts. So if someone were to come in and provide, testing in a different area of the nation, which currently has a need, then that's wonderful. I think if we can then complement that by coming into and supporting a different area of the nation that has still an unmet need or a lower capacity, that would be wonderful. So I think that would ultimately be the goal, and agree with you, Joe, that Ideally, next step would be to be able to have more conversations like that, so that we can understand better where we can best be helpful.
Thank you.
That concludes our response, unless there's a follow-up.
Stewart?
No, there's no follow-up. It was just to ask, if you knew of that group, which you don't, but I did forward that information to our speaker as well by text, which is what I received from them. And like I said, it was just a group that worked with the White Mountain Apache tribe just recently with their COVID-19, and also, that they want to reach out to Navajo. And they did state that they were trying to get a hold of other leadership as well within Navajo Nation, but there was no response until I responded, and it was just from a community member that had a connection with this group. So that's why. And then, like you said, all the intentions are good, and that's what we want for our nation, a good intention and good results. And so, you've answered my question. So thank you for that. That's it, Chair.
Hey, thank you, Honorable Stewart. That, we're going down. Honorable Otto So.
Thank you very much, Speaker Otto, members of the council, Otto, the audience listening in the web and whatever technology source that's out there that you're listening on. And then to the presenters, your presentation really brought light to a lot of what I have on my mind. Testing is something that is very critical and needed on the Navajo Nation, whether it's on the Arizona portion or whether it's in the New Mexico portion or Utah portion. But what I'm getting to is that I really your proposal.
I just wanted to see what my band to pay the people in this.
Can you guys mute your phone?
Honorable Elmer Begay. Honorable Elmer Begay. Honorable Elmer Begay, can hear you. Can you please mute your phone?
And what I'm getting to is that if United Way comes into Navajo, and I really like your offer relating to bringing 8,000 testings to the Navajo Nation and utilizing it at free of charge, and then afterwards, after 8,000, will be a financial commitment that would have to be made. My thought, members of the council, is that maybe if we entertain this proposal and get it out, bring in all our healthcare providers on Navajo, whether they're the healthcare corporation or whether they're IHS. How can we get United Way to partner up with these healthcare facilities on Navajo, because they receive COVID dollars too from the federal government. And with this, this would be in line with the trust responsibility of the federal government. And that way, like for instance, is that the IHS can go ahead and divert some of their COVID dollars that had been funded to these hospitals, whether it's in Gallup, whether it's in Chinle, whether it's in Kayenta, to use those fundings to pay for the rest of the testing that could happen. So those testing blitz that Honorable Nate Brown is asking for in Kayenta could happen. That testing blitz could happen at Ganado. That testing blitz could happen in Cameron. That testing blitz could happen in Naabik'iyati, out there in the remote areas, so that United Healthcare can help with with the administering these testing throughout Navajo. I think it's something that we need to look at, and we will have to have a conversation with IHS and with our healthcare corporations throughout the Navajo Nation because for instance, how much did Tuba City Healthcare Corporation receive in COVID dollars? How much did Winslow Indian Healthcare receive in COVID dollars? How much did Utah Healthcare Facility, the 638 facility, receive for COVID? How much in general in Navajo area did COVID funds come in? So if we could utilize this back to the trust responsibility of the federal government to pay for the rest of the testing that can occur on Navajo, that's just my thought. And it's a shot. And if leadership could, like I indicated, if we could get IHS and the 638 facilities to get on the bandwagon, we can work with them and have United Healthcare Group administer the tests at a broader scale throughout the Navajo Nation. And again, thank you very much, presenters, for your presentation. You have my attention. And I too want Navajo people across the Navajo Nation, whether it's in Torreon, whether it's in the community of Bitter Springs, those people in the outlying area, we need to get testing done for those community members. So that's all. Thank you.
Thank you. Thank you, Delegate. So I appreciate your trust and confidence in our abilities. Again, reinforcing that there are going to be multiple organizations involved in one form or another in order to pull this off. And it would certainly, just I want to reemphasize that it would be a key element of our plan to ensure that we are coordinating with and partnering with other facilities, organizations, where it makes sense so that we can achieve the ultimate goal, which is reduce the infection rate on the Navajo Nation land, reduce the death rate, take care of those that are COVID positive, and test everyone. So I appreciate your comments. Dr. Chekmakian?
No, thank you, Joe. Appreciate it.
Mr. Speaker, that concludes our response for that question, unless there's a follow-up. Mr. Speaker?
Yes, thank you. Thank you for that response. Colleagues, I don't have anybody else on deck here.
Speaker, this is Delegate Brown.
Honorable Brown, go ahead.
One final thought is I did send an email and a letter out to DPM Director, Dr. Fowler, as well as your office and the attorney. So I requested to repurpose some of our non-essential Navajo Nation employees. A lot of our employees are being paid. However, they are staying at home. So what we need help with Doctors Without Borders is we need to hire at least 2 to 3 people per each chapter in my area and Western Agency to be the boots on the ground. So Doctors Without Borders is training people on COVID-19 and all the surrounding educational factors, such as why do we say 20 minutes washing hands? Why do we wear face masks? Why do we say social distancing? And we have a group of Navajo speakers who can also do the presentations, being the boots on the ground, of course, with the proper PPEs, with the proper protection and education. Right now, the numbers are still rising, and we do understand that a lot of our people do not have the correct information. So they're still traveling even when they're positive, and they're not wearing the proper PPEs. So if we can repurpose our Navajo Nation employees who are being paid and to get the proper training to make sure that they get testing also. So I did send that email out a couple of days ago. So if we can entertain that and possibly put that on the next agenda to repurpose our people who are employees who are being paid. Thank you, Speaker.
Delegate Vince James.
Honorable James, go ahead.
Thank you, Speaker, and then also presenters and colleagues and individuals that are listening to World Wide Web. Thank you. First, this is Delegate James, and I represent Kindahachi, Ganado, Cornfield, Steamboat, and Jedito. And my request is also with the rest of my colleagues requesting test kits. We do have Sage Memorial Hospital here in Ganado that serves the surrounding communities. If you can assist us in that way, and I strongly am asking, kindly requesting for some of those testing kits. We just learned yesterday that, the wife of the late individual, the virus has taken a family out from the community here. First, it was the oldest son. He passed on. Then his father passed on a week and a half ago. And now his wife, the mother of the oldest son, passed on yesterday. And now the second oldest daughter is on life support down in Phoenix. So that's how it's really, really affecting my communities, and it has taken out a family. And I know there's other families that are in the same situation that we're trying to assist. So if you can assist us in that way, that'd be helpful. Thank you.
Thank you, Honorable James. I don't know if anybody has any response to that from United Health.
Speaker, this is Delegate Charles Newton. I've also got a question.
Okay.
It's a really quick question. I appreciate the presentation that has been given to us today.
Madam Chair, hold on. Is United States Health still on?
Yes, I'm still on.
Okay, I don't know if you have a response to Honorable James' request about testing or.
Yeah.
Yep.
Okay.
Go ahead.
Joe. Can you hear me? This is Joe.
Yes, yes, we can.
Okay, thank you. I had to switch off my earphones because they were running out of juice.
No, it's okay.
No, thank you, Delegate James. And again, it would clearly be our intention if our engagement, was just the initial 8,000 kits. Our intention would be to work very closely with the nation and the representatives of various chapters to ensure that the distribution of those unfortunately limited resources, 8,000 kits, would be fair and equitable and where they would where they're most needed. But of course, the goal would be, we are in a position where we can offer a more broad solution with funding, with the intention of ensuring that all chapters and all residents are tested on a timely basis. But again, reinforcing the need of the need to work together to identify the appropriate approach, the appropriate model, and if resources are limited, fair and equitable distribution of those resources. Dr. Turkmakian, anything to add on that?
No, 100%, Joe. I agree with the comments and can appreciate that we recognize there's a need. And I think we would ultimately rely on the delegates and the various chapters to help us understand, to your point, where could we best help, and how could we best help as quickly as as quickly as it's needed. Thank you very much.
Sure. Mr. Speaker, that concludes our response. Unless any follow-up.
Great. That we move on down to Madam Chair Charles Newton.
Thank you, Speaker. Also to the presenters, thank you for the information that you provided to us. This was just a really quick question, and I know it's probably very obvious, but I do have to ask, the assistance that you are talking about providing to the Navajo Nation, does that only apply to the Navajo Nation in Arizona? Does it apply to New Mexico and Utah? That's my question.
Thank you, Delegate, for the question. Now, our solution would be to serve the entire nation, so crossing state borders, New Mexico, Utah, Colorado, in addition to Arizona. And again, if it's a full solution, without a doubt. If it's the 8,000 tests and it's just limited to the 8,000 tests, again, to my earlier comment, we would work with the appropriate representatives from the nation to identify the best deployment of those 8,000 resources or those 8,000 tests. And again, it is not our intention that those 8,000 tests or any other solution just be limited to the Arizona boundaries. No, we'd be looking to serve the entire nation, the entire geography.
Great, thank you for that. All right.
Speaker, this is Vice Chair Smith.
Vice Chair Smith, go ahead.
Thank you, Speaker, and thank you, presenter. I have a situation down here in the Newlands area. Surrounding communities that I represent is Lupton, Houck, Pine Springs, Chambers, south of Allentown, Wide Ruins and Flagatoe, including Sanders, Newlands. My concern, I don't know if this is at this point in time, but they closed down the Naabik'iyati clinic. For what reasons, we don't know. Many of our constituents are asking that it be reopened, that they need services down here, and they need to be also tested within the vicinity of the Seltzo Medical Center that's over the oversight, I guess you could say, for the Naabik'iyati clinic. That's the main concern that I'd like to bring up, Speaker. I don't know if this is the right time to address this, but Houck has been adamant about it. Lupton has been adamant about it. Sanders and Newlands and Wide Ruins. And I know Flagatoe usually goes to Ganado or comes down to Naabik'iyati, but we do have clientele that are asking, why did they close it down? It should be open. It should be readily available for folks that need help on behalf of their medical, picking up pharmaceutical stuff and things of that nature, Speaker. That's one thing they wanted me to express and see if that can be reopened as soon as possible. Thank you, Speaker.
Great. Thank you, Vice Chair Smith. Let me go ahead and hand that over to United Health.
Yeah, thank you, Mr. Speaker. Thank you, Vice Chair Smith. Certainly can't speak to this particular clinic and why it was closed, but what I can say is that, again, another area where United Healthcare and its sister organization, Optum, we can look to help here. Optum, our sister organization, Optum Care and Optum Serve, they do provide direct care in many different ways. And if there is a gap due to a result of a closed clinic, not just in the area you were mentioning, but anywhere, and there's clearly a gap in services, that is another area where a potential solution, which is bringing in some type of mobile clinic type of an arrangement to ensure that the needs of these individuals continue to be met, especially during this time. But we do have that capabilities, and that is something that we would certainly look to better understand and discuss, and provide a proposal if that is the desire of the nation around where those gaps are. But it is certainly something that we can look to help address. Dr. Chekmakian, anything that from your perspective to add?
No, I think that's an interesting thought, and again, an example of your sharing with us where there may be specific needs that we would not have imagined or maybe necessarily understood, and then in learning that, being able to think of things a little outside of the box, and certainly outside of the core aspect of what we presented today, which might present other solutions that would be beneficial. So I think, Joe, that that's just an example of we don't know what we don't know, and that's why we're here to listen and to understand how we might be able to be of greatest support.
Thank you, Dr. Chekmakian. Mr. Speaker, that concludes our response to that, unless there's a follow-up.
Speaker, one last question.
Okay. Vice Chair Smith.
Thank you. Thank you for that information, United Way. I appreciate that. You can see if you can outreach and help with the communities that I represent. My question to Speaker is, do I get a surrounding communities to do a resolution to have United Way assist in providing that services down here during the time of this COVID-19? Or what's your recommendation on this, Speaker? Thank you.
Speaker, Delegate Daniel So.
Hold on, Jim. Okay. Good morning, Chairman So. Let me go back to Vice Chair Smith. Vice Chair Smith, can you restate that again?
Pursuant to what was just said regarding the United Way one to address the concerns that I brought forth, that Naabik'iyati clinic has closed and they can assist in helping our community members. Would it be wise for the communities that I represent down in this area to get resolutions to have United Way address this concern, like they said they can assist in this COVID-19 pandemic? That's my question to Speaker.
I think in ways that we're moving forward and next steps that we're going to start tackling, that would definitely be a great opportunity for you to have those position statements readily available, Vice Chair Smith, and to the team from United Healthcare. I know that we are starting to move forward because I haven't heard any objections so far. I just heard there might be some obstacles in place that we might have to move forward with. But just moving forward, I think we just need to sit down individually and not only with the staff, but also individuals like from Department of Justice, so that we're all in compliance, meeting all liability information and making sure that the Navajo Nation is willing to maintain our goals, and United Healthcare is wanting to push their initiatives, and we're moving our boats in the same direction. So with that, that's something that would be probably more a step ahead of the course right now, Vice Chair Smith, if we do that. So we can go ahead and look to that direction if there is going to be, and most likely there will be, needing a legislation at some point in time in order for us to go ahead and move forward and letting United Healthcare open up their operations on the nation.
Thank you, Speaker. One last thing is, why were they closed? That's what I'd like to know, too. Could you inquire that through Salem Medical Center so I can report that back to my constituents? Thank you, Speaker.
638 hospitals are going to be on this afternoon. So maybe somebody from Fort Defiant or Salem Medical Center will be there, and you can ask that question, Vice Chair Smith.
Thank you.
Okay, with that, Chairman So, floor is yours.
Thank you, Speaker, Chairman Otto, colleagues on the call, and for the folks with United Health Group. As far as what Brother Raymond Smith talked about, I think United Health already has a working relationship with IHS. As I recall from last week's call, there was a Dr. Fuentevilla that was going to be at Northern Navajo Medical Center. I know on the call she said she was going to be on the floor of the hospital providing care within a few days of the phone call from last week. So in that respect, there's the precedence that's already been established. And that's where the United basically can keep coordinating with the Indian Health Service, much like the other groups, Doctors Without Borders, and various churches and missions that are also bringing in doctors and nurses to basically reach out to the folks at what we call the Hogan level, at the home level. Right now, the 638 facilities and the IHS hospitals, they're basically flooded and can't do some of those aspects of care at the home, where as that's already been talked about, doing the education about, number one, keeping a family member isolated, even though there's multi-generational members in the household. Those aspects, I think, is where the focus basically comes about. And you know,
although other structures,
and you know, the other aspect is, yeah, we get tested, but you know, what does it mean?
Yeah,
to get tested, to get, you know, to be relieved, but then to be tested positive, then basically, you know, the healthcare facilities, you know, they're so overwhelmed, they're telling the folks, go home and self-quarantine, self-isolate. And that's where United basically can, I feel like, be a link to the homes. Just because certain delegates are saying, we can get you money, but don't be looking for that money. You're coming to the nation to say, this is what we have to offer. And mind you, it's an unsolicited offer that you're bringing to the nation. And so in that respect, you know, much like the Doctors Without Borders, they're not looking to get a foothold in the healthcare delivery system on the nation. They're doing it because that's what they do worldwide. And I guess for me, as chair of the HES committee, that's the expectation. That's the expectation. Last week, I basically said, we're thankful for the offer, but at the same time, we're not going to, after much thought and consideration, you aren't going to get free rein to go do what you think is best. We have to go forward hand in hand. You have to get to know the lay of the land, because each community is so much different from a neighboring community, and their needs are basically very different. And that's where one has to understand the Navajo population is very diverse in how they have proceeded, how they've advanced, how they've progressed in the years coming to this time. So that is, I guess, putting pepper on your thoughts, and maybe it'll make you sneeze, and maybe you can it'll add flavor to what the discussions has progressed. I was on a different call, speaker. I was on a different call earlier, and basically with the Naabik'iyati Association, and of course, that's been since time immemorial the healthcare system of the Navajo people, and so that is, I guess, my thoughts as we go forward. Committee folks that are still on the line, that is the perspective I put on the table for today's discussion. Thank you, Mr. Speaker. I'll go back on mute.
Thank you, Chairman. So,
thank you, Chairman. So, Mr. Speaker, if I might reply.
Yeah, you can. Go ahead.
Thank you, Chairman. So, thank you for those comments, and it's a pleasure to hear your voice again. Appreciated the discussion last week, and certainly your comments are not making us sneeze. They are clearly adding appropriate flavor to what we're trying to do here. And again, it is an unsolicited offer, and we desire to help, but we desire to help in coordination with the nation. We desire to help to learn first, so that we can bring the appropriate solutions to the table. I mean, we have a model, and right now it's a model, and it is being deployed in 2 other markets. But the model will certainly need to be refined based on the uniquenesses and the challenges of the nation. And it is clearly our intent, without a doubt, to move forward hand in hand. And I believe the term used last week was with open hearts and open minds, with the solutions that we can bring to bear. And that is clearly our intention, not to try to do it on our own, and certainly not to think that we know all the answers, because we don't. We certainly don't know all the answers. We don't know, there's certainly a lot more that we need to learn about the different communities and the different needs for each community, and how we need to tailor our solutions to meet those needs. But it starts with listening and learning, and that's why we're here today. And and I hope that the Mr. Speaker, Mr. Chairman, and the rest of the delegates, I hope you see that today from United Healthcare. We've made an unsolicited offer on a model that we think there's a need that can support a need on the nation, but it's a model right now. It needs to be more refined and understanding that we need to work hand in hand in a spirit of trust, communication, and coordination in order to make it work, because we don't know all the answers. Dr. Chikmakian, anything to add?
No, I agree, Joe. Thank you very much. I agree.
Mr. Speaker, back to you, unless there's a follow-up.
Thank you with that. And thank you to my colleagues for your questions and more of an outline of the direction that's looking at grasping and making sure that we can go ahead and follow in the days forward, working together with United Health. And I know that United Health currently has a position in actually a place on the nation in Shiprock. Is there another area that you guys are working out of?
No, I believe to Chairman So's earlier point, I forgot to mention, Dr. Fuentevilla is on site today. I believe she was traveling yesterday, and she's on site today and will be on site for 2 weeks. Dr. Chikmakian, do you remember the hospital that she's at?
I don't remember, Joe, the specific clinic or hospital she was at. Sean, I know you're still on. Do you happen to recall?
Just from the notes that I have, she said Shiprock, but I can further explore.
Yep. All right. And so, no, we don't have, right now, Dr. Fuentevilla is the only resource we have on site, and she'll be serving, her plan is to serve 2 weeks in that hospital, I believe, in Shiprock, but nothing else that we have on land, right, or tribal on the nation today.
Great. Okay. Well, colleagues, I don't have anybody else on the queue right now. So I guess moving forward, one of the most important things that we can do is I know that Carlisle's been working together with you all, and I think that the most important thing is just trying to adapt your model that you have put in place, maybe putting together a group on our side, maybe a task force made up of not only professionals in the industry, but members of not only the executive and the legislative branch too as well, to help assist in formulating a group that can go ahead and make that possible, so that we can start getting regular updates on how this is going to unveil itself in the future. So I think that's one of the first and foremost things we can do is get that task force and specifically adhere to making sure that that is a possibility on one big recommendation on not only having a group that you guys have already put together, but an initial group that will focus in on the logistics of it. Two is more of a policy initiatives that need to be possibly be needed if amended or changed or even created in reference to the development of your organization coming onto the nation. And three, and I think this is foremost, is that the public input and more of the public information that needs to go out so that this unveiling process can be well adapted, so that the nation and not only the leadership that's on the phone call today that's discussing this, more importantly, the individuals in the community leaders, and also the people themselves know what kind of opportunities can and will be available if United Health does continue to go down the path and once again opening its doors here in the nation.
Thank you, Mr. Speaker, for that. I think that sounds like a the right process moving forward, and we look forward to working with that task force. We will continue to coordinate through Mr. Carlisle Gay, and we stand at the ready to move forward with next steps and discussions with the task force, but we will await word.
Great. Thank you again. Colleagues, any further comments, questions? Before we close it out?
Speaker.
Honorable Eugene So.
Speaker, this is Dr. McGay.
I reckon you can start off with the CHRs, the care providers, healthcare providers. They've never been tested. They're dealing with patients every day, delivering water, food, medication, firewood, and coal, etc. And they don't get even tested. They're short of being tested. You need to start with those guys. Thank you.
Okay. Thank you, Honorable Eugene So. Chairman Daniel, or Honorable Elmer Begay, and then I'll go back to you, Chairman So. Honorable Elmer Begay.
Okay, thank you, Speaker. Again, this is Delegate Elmer Begay. I have a question on the policy. Remember this morning I mentioned about the bad practice that happened with the Windsor Indian Health Care Center and Little Colorado Medical Center in Windsor. So, this is United Healthcare. What kind of policy is it being practiced? I know that Windsor, Navajo area, IHS, they have a policy on how these patients supposed to be being taken care as a provider. So I don't know how much your policy are being aligned with IHS, and I know that they're more restricted. So especially with this the new pandemic of COVID-19, they have a restricted policy to go by. So I don't know how much you are aligned with the IHS. So that's my question. Thank you.
Okay. Thank you for that question. And we have been in close contact with federal authorities and the policies and procedures that we operate under during this crisis that have come about as of this crisis are certainly in alignment with all federal and state guidelines, and that would be in all 4 states as well, because there are different state mandates that come through as a result of this crisis, specifically for the Medicaid populations, but also in the commercial population as well. But regardless, the policies that we've been operating under are aligned with all federal guidelines, and I would think that the hospital facilities and so forth, and the other provider facilities are also operating under those guidelines as well, especially if they're taking federal CARES funding. And we have quality programs and departments designed to ensure that appropriate care is being delivered in facilities, and if it's not being delivered in facilities or if it's outside of guidelines, anything that we're aware of, we will investigate and follow up. Dr. Chikmaka, anything to add?
No, Joe. I think that all sounds appropriate, and as has been with past endeavors and efforts to meet with and speak with, I think a number of the tribal facilities, we understand that there's a process and that they're the healthcare authority in those communities. And I think what we've sought to do then and now is to understand with all the appropriate regulations and rules and authorities, how could an effort like this support and complement what they're already doing. And I think that would ultimately be our goal, is to work together with all due respect to those facilities and those healthcare authorities.
Okay, thank you. With that, we move on down. Chairman So, final one.
Yes, thank you. And to United Healthcare, I appreciate the response, and then the work in earnest to come to the nation with a number of tests as well as some thoughts on going forward. And it brings to mind the fact that there could be a new aspect to what healthcare on the Navajo Nation is. It's always been just the aspect of it's a trust responsibility of the federal government. And as such, we've really seen that the funding level has really been inadequate. The hospital facilities are inadequate. At the start of this pandemic, I think we only had 5 ICU rooms. But with the new monies that are coming up, that the numbers will go, there'll be 15 new ICU rooms. And so in that aspect, going forward, rather than to continue to look at it as a trust responsibility, then how can we also enlist other folks to add to the healthcare system? Because healthcare is a human right, and that's the prospect we need to use as we go forward. It is a human right to have adequate health care. So in that respect, I appreciate United coming through, and we certainly will look at this as a new way in developing the healthcare system going forward. Thank you again. Appreciate the opportunity to be able to talk in earnest, and for your response. Thank you. It adds to the conversation to also look at new developments as we go forward. Thank you.
Thank you, Chairman. So I appreciate the comments, and we look forward to working with you.
Okay, colleagues, again, we can go ahead and follow through on recommendations. And then I have one more individual, Honorable Otto So.
Yeah. Well, I would like to commend United Way for their the way they handled the question from Chairman So. Why don't you come out to Tuba City and Western Agency and start your testing there? We want you. We want these testing to be done. And for me, you know, it's not the fact of waiving money, funding. It's the fact of trying to get people served relating to COVID. And we need to get as many people tested on Navajo. And I really would like the United for you. Thank you for your presentation. There's many options. And yes, we have to play the card of the trust responsibility. And I really would like to have a conversation with IHS in our 638 facilities so we could utilize these COVID dollars that came down the pipelines that were directly infused into our healthcare facility here. It is a trust responsibility that the federal government owes the Navajo people, all of Indian people. And therefore, you have my attention, and I really want to try to nurture this. And how could we continue to continue this conversation in a positive reflection that could better and improve the livelihood, the health of the Navajo people as a whole. But again, thank you very much for being online and trying to make your pitch here. That's basically what it is, and it's doable. At least you're bringing something to the table, and that is the bottom line that I have. You're bringing something to the table. But again, thank you very much, Speaker.
Okay, thank you. Thank you, Honorable So, and thank you to, again, thank you very much for United Healthcare for coming on last minute. I know that you guys filled a void in the agenda this morning, so thank you for that, and thank you for the information that you've given to my colleagues on the Naabik'iyati committee. We look forward to further discussions and great in the aspects of not moving forward with the council, but more importantly, getting to know the oversight as Health, Education, Human Services Committee, and then also working with our partners on the executive side too as well, most importantly, and trying to come up with a real good roadmap on executing a rollout. So again, I look forward to that discussion, and with that, I know that working together with the Speaker's office will be go ahead and starting to move forward in that task force initiative and trying to make sure that we get both sides of your agenda and our agenda and collaborating that and using your model as a base, but more importantly, growing off on that base in order to adhere to not only the tradition and culture of Navajo, but more importantly to the people itself here in, as indicated from all of my colleagues that were having questions and comments today. Each one of them comes from different areas. They represent different areas of the communities across this vast nation that we know as the Navajo Nation. So again, thank you very much for United Healthcare for coming on this morning, and we look forward to those further discussions. Yeah. With that, colleagues, I know that we have a break right now for about 30 minutes. So let's just go ahead and go into recess for about 30 minutes, and then we can jump back on at 1 o'clock. At that time, we do have confirmation that Chief of Staff Paulson Chaco has given permission to Ms. Gishi to provide a status report to the council on social services, our Division of Social Services, Division of Aging and Long-Term Health Care, and then the CHR program. So look forward to that discussion. I do believe that legislative staff assistant, Ms. Sherilyn Yazzie, too, is working together with getting Ms. Rosalind So and the 638 hospitals on, too, as well, for an afternoon update. Other than that, colleagues, again, that will start here at 1 o'clock on this same number. You're more than welcome to stay online, but we'll go ahead and put it on pause for about 30 minutes right now. Thank you again to the individuals from United Healthcare for being on this morning. You guys, we look forward to working with you. Just again, you do have Carlisle's information and Chief Chief of Staff LaShawna So's information. So thank you again for being on.
Thank you very much, Speaker.
Good. Colleagues, the meeting will still be going, but we will just be in a pause mode or in a mute mode for 30 minutes until we get our presenters ready. We thought we were going to move right into it, but we are early, so we'll go ahead and again jump back on at 1 o'clock. And that's in about 33 minutes.
Hello? And here what they're... Hello, are you on the line? Hello, this is Deanna. Naabik'iyati calling in. Hi, Deanna. Thank you. This is Sherilyn Yasi. They should be back on momentarily. Just hold for a moment. It's good to hear that you're on the line.
Okay. Then, like I said, my report should be forthcoming from Rosalind again.
All right. As soon as I receive it, I will forward it out.
Mm-hmm.
You're welcome. Just
okay.
Go.
Thank
Hang
you.
on. Thanks.
This is Christopher Curley, president of 638 Association, calling in for Nabi work session.
Thank you for calling in, Mr. Curley. Just please hold. Somebody should, Nabi should be coming on the line here momentarily. Thank you.
Okay, thank you very much.
Good afternoon, everyone. This is Speaker Damon. We'll be beginning shortly. First roll call, then probably here in about 3-4 minutes. Give us some time to get back online. Everybody on the World Wide Web is continuing of a Naabik'iyati Committee work session. We'll be listening to social services this afternoon, Division of Social Services, Division of Aging and long-term care support and community health representatives, and also maybe we'll see if we can get Dr. Jill Jim on the line too as well. I don't know, is Ms. Yazzie, you on the line? Is did we get a hold
Yes, I am,
of
Speaker.
Rosalind So in the 638 hospitals?
Yes, Rosalind So will
Okay.
be calling in here momentarily. She's
Okay, great.
trying to get off another conference call, Speaker.
Honorable
Speaker, I just
Damon, this is,
received Rosalind
Christopher Curley.
Begay's report. I will be forwarding it to Chief of Staff right now. I'm sorry. I just received Executive Director Deanna Gishi's report, and I will be forwarding it to Chief of Staff right now.
Good afternoon, Honorable Speaker Damon. This is Christopher Curley, 638 President, calling in. Mr. Davis also will be calling in, Chief Operating Officer of Winslow, Representative 638.
Great. Good to hear your voice, sir.
Thank you.
Again, good afternoon, everyone. This is Speaker Damon. We'll go ahead and begin here shortly. I do have individuals calling in from the 24th Navajo Nation Naabik'iyati committee members, and we do have some participants, presenters, and staff from the executive branch. Thank you very much for calling in. To the staff and legislative, thank you for being on the line. And most importantly, to all the listeners out there on the World Wide Web, whether you're on Facebook, YouTube, or Vimeo, thank you very much for listening in to this afternoon. We're going to be discussing this afternoon as a Naabik'iyati committee. We did have started off a work session this morning about 9 a.m. and that was on this whole work session actually is on legislation 0115-20 or resolution CMA-44-20. And it's actually, just to do a recap, that legislation enacted the Navajo Nation Cares Fund Act, which was a fund management plan for the Navajo Nation's recipient of funds that was received from the blessing from Congress and President Trump, and then ultimately from the United States Treasury and Department of Interior. There was a total amount of $8 billion that was allocated to federally recognized tribes or tribal nations. And out of that $8 billion, the Navajo Nation received its first portion of that funds, received a little over $600 million. And that's what we're talking about here today. We're listening to individuals, and this afternoon we're listening from a social services department to really look to see what they're looking at and needing and what they're really trying to identify in their goals in order for them to go ahead and get some of these dollars, particularly in support of funding, in this case, all the social services departments across the nation and everything that the social services utilizes and works towards. And that's including working together with different agencies, working together with our community health representatives out there in the field, working together with our elders programs, working together with our 638 programs like TANF and Light Heat. But that's just some of our social service programs, or another examples like our burial assistance and anything to do to help our people. And this afternoon we'll be listening from Dr. Neswood Gishi and her recommendations. More importantly, I think her staff will be on board too as well. I do believe that we might have Dr. Jill Jim on this afternoon. We thank Mr. Chaco for allowing them to give a presentation and moving forward and coordinating that effort and realizing that the Navajo Nation needs to work together. And thank you very much, Chief Paulson Chaco, for allowing that to move forward. More importantly, the discussion that will be here again today is this afternoon is from our social services department. So let me go ahead and go back to is Ms. Nakai, are you on the line? Nope. Ms. Karen Doki?
Yeah, I'm here.
Hi, Ms. Karen Doki. Could you mind, let's go ahead and do a roll call right now, and then we can go ahead and move forward.
Okay. Honorable Seth Damon?
Present.
Honorable Seth Damon, present. Honorable Alfred P. Begay? Honorable Key Allen Begay, Jr.? Honorable Paul Begay, Jr.?
Paul Begay, present.
Honorable Paul Begay, Jr., present. Honorable Nathaniel Brown? Honorable Eugenia Charles Newton? Honorable Amber Knezbar-Karate. Honorable Herman M. Daniel. Honorable Mark A. Freeland. Honorable Pernell Halona. Honorable Jamie Hingham. Honorable Vince James. Honorable Ricky Nez.
Delegate Rick Nez is present.
Honorable Ricky Nez is present. Honorable Carl Slater. Honorable Raymond Smith Jr. Honorable Wilson Stewart Jr. Honorable Charlene So. Honorable Daniel E. So. Honorable Eugene So.
Present, here.
Honorable Eugene So is present. Honorable Otto So. Honorable Thomas Walker Jr.
Thomas Walker, here.
Honorable Thomas Walker Jr. is present. Honorable Edison J. Winika. Honorable Edmund Yazzie. Honorable Jimmy Yellowhair. Speaker, you have 5 members present.
Great. That, we do have a couple members present. Thank you again to all my colleagues for being online. I know that there's a couple of other meetings that we started right now, but more importantly, this discussion is to hear what social services is needing in order for them to operate throughout not only this time, but in the future, and possibly prepare themselves for if anything were to happen like this again. Again, we did have an invocation this morning, and it was a very beautiful invocation from Vice Chair Walker, so thank you for that. So let's go ahead and move forward on the social services presentations. Just to remember to everyone that's online, that's calling in, whether it be my colleagues, staff members, presenters, anybody that is on the phone call, please make sure to mute your phones if you're not talking, because we can hear your discussions. We've heard it all, and I don't think we need to hear any more this afternoon. So make sure to please keep your phones on mute. With that, let me go ahead and go on down to Miss Dr. Neswit Gishi. The floor is yours.
Good afternoon, Honorable Speaker Damon.
Good
Members of the
afternoon.
committee. I think you promoted me saying a doctor. I'm not quite there yet, but I'll be an honorary doctor for today.
Okay.
Anyway, the Navajo Division of Social Services, we have 3 departments and programs, as well as the Office of the Executive Director. So our 6 programs and departments. First is the Department of Child Care Development, which is our child care program. The Department of Family Services, that is the majority of our direct service programs. That is where we have the immediate first responders of child and adult protective services. We also have the family violence program. We have regular case management. We have the Arizona long-term care services as well. We also have staff who are working with our nursing home, our elders, adult in-home care programs. So that's the bulk of the Division of Social Services. Next is the Department for Self-Reliance. That is the Navajo Nation TANF program. Department for Self-Reliance provides assistance to families, single parent, two parent, or a child-only case to help individuals to become self-sufficient as far as providing training, post-secondary education to those individuals. Next is our Developmental Disabilities Program. And so within that program, they're working primarily with individuals, youth, majority adults who have a disability. And so that's that program. Our fifth program is the Navajo Indian Child Welfare Act program. And this used to be the Navajo Family and Child Services, but we actually have the plan of operation approved. And so that is the new name. And Indian Child Welfare Act is the program that provides services to children who are off Navajo. Currently, we have children in 26 states. And so that is that program. Lastly is the Navajo Treatment Center for Children and their families. They provide therapeutic services to do trauma reduction to children, as well as working with the families in their home or in school settings. The Division of Social Services, we operate with 546 employees who serve a combined total of 13,877 clients through 58 administrative and direct service office and centers. So we're one of the bigger divisions. Division of Social Services responds to the following questions posed by the Honorable Delegate Seth Damon, Speaker of the 24th Navajo Nation Council, in his letter of invitation dated May 20, 2020. The first area is the current expenditure plan identify unforeseen expenses incurred since March 1st, 2020. The answer is there is continuing need for adequate supply of personnel protective equipment and disinfectant supplies such as facial masks, disposable gloves, hand sanitizers, disinfecting wipes, facial clinics, and paper towel. COVID-19 burial assistance, a total of $508,832 was spent using total combined funds of $546,500, which is from the Navajo Nation General Funds, the Navajo Nation General Funds COVID-19, as well as the Navajo Epidemiology Funds. The daily average request of is between 8 and 10 per day, which is about $20,000 to $25,000 per day of requests for burial assistance, all COVID-19 related. A total of 218 requests have been served. I want to sort of add on the personal protective equipment. We do have staff, adult protective services, as well as our family violence staff who are working directly with families impacted by COVID-19 virus. And so this is where the PPEs are necessary because we have children who may have the COVID-19 virus. And so the staff need to have the gowns, the N95 mask, and we have generously received homemade masks. But for staff who are working directly with individuals' children, they do have to have the correct equipment for their protection. The next area is the department program unmet needs since the onset of coronavirus pandemic. Since March 13, 2020, the Navajo Nation government offices were closed and will remain closed through June 7, 2020, pursuant to the Navajo Nation Executive Order 001-20, 002-20, 003-20, and 004-20 to mitigate the spread of the novel coronavirus or COVID-19 virus. And only essential employees are allowed reporting to their respective work sites. Currently, we are at 98% of our staff are considered essential governmental employees. And the employees a majority of them have returned back to work as of March 27, 2020. The employees are complying with, we did a return to work plan, guidance memorandum, and the Navajo Nation Health Command Operations Center and CDC guidelines. Division of Social Services will need additional funding to pay its employees hazard pay. The third area is the implementation of best practices for the Navajo Nation employees as they provide services to the general public, including budget forecasts. Okay, despite the Department for Self-Reliance field offices closed to the public, the Department for Self-Reliance Direct Services continue to provide case management support to its customers and families by communicating through telephone, email, and regular mail. Department for Self-Reliance customers can submit their documents via cell phone, by email, drop-off box, and regular mail. Department for Self-Reliance is using Skype for meetings, online training, and to onboard all new employees to be trained on the Tribal Assistance System, also known as TAS, which is a case management software. Department for Self-Reliance also does policies and procedures as well. Department for Self-Reliance intends to increase services to its customers for online courses for GED, extended vocational training, online employment application, access to local college and universities, online courses, and subsidized employment for adults. Department for Self-Reliance also requests for each landlord to install a drop-off box for each office for Department for Self-Reliance customers submit their necessary documents, and to request to each landlord to install an intercom at each office to communicate with Department of Self-Reliance customers. Department for Self-Reliance, they have all of their offices are leased. They don't occupy Navajo Nation buildings. For Department for Self-Reliance, social workers completed a COVID-19 safety assessment tool prior to scheduling home visits to ensure the home is safe. Social workers are taking precautionary steps to protect themselves, such as meeting with the family outside the home. We're also learning the new normal as staff continue to provide services to children and families across the Navajo Nation. Lastly, the last question was regarding current infrastructure projects. The Division of Social Services Information Technology infrastructure to be upgraded to have all departments and programs use the same case management software, to integrate services and have a one-stop shop concept to offer a client access to the array of services to select from his or her application forwarded to the appropriate department or program. To use the case management software to generate reports based on the data entered to support the increases, prepare for audits, and to share with stakeholders for planning. To have a staff development training program using technology such as online video and Skype for all Division of Social Service employees to receive onboarding, required training, and unnecessary training. So we have submitted our proposal regarding the Navajo Nation CARES Act funding proposal, and so that has been submitted to the Chief of Staff, Paulson Chaco, on areas that we're looking at as far as documentation. We need to have a data and system documentation. Next is to do telework deployment. We're not quite there yet. Therefore, as stated earlier, 98% of our employees are at work because we don't have the technology infrastructure to do telework deployment. Infrastructure improvement, we have started that already. We have had a thorough infrastructure assessment from our internet capabilities, our equipment, our database system. So that has been completed as of February 2020. We're looking at our hardware installation and configuration. We're looking at software installation, configuration, as well as telephone installation and configuration with help desk support. Thank you, Honorable Speaker Naaman. Thank you.
Thank you. I guess my one question is, you were referring to a proposal. Do you happen to have a copy of that proposal so we can look at that too? Ms. Ogishi?
Yes, Honorable Speaker. Yes, we do have that, and that has been submitted to the Chief of Staff on a cover memo as of May 20, 2020.
Okay. Is there any way we could get a copy of that so we can share that with the delegates too?
I will request Ms. Rosalind Begay. She's on the call as well.
Okay, because we got a Division of Social Services overview, and that's what you went over dated May 27th. That's the only thing that
Yes.
we received from her. So maybe if Ms. Rosalind Begay could send that over too as well, because that's the information we want to share so that we can start putting the puzzle pieces together in order for us to start funding this expenditure plan. So, is there any questions? I mean, does that conclude your report?
Yes, it does. Thank you, Speaker Damon.
Okay. Colleagues, any comments, questions?
Eugene So.
Go ahead, Eugene. So, Honorable So, go ahead.
A question with regards to the Child Welfare Act and also the Self-Reliance. The qualification, what is the qualification? They usually have percentage of Indian blood. I don't know, but on the Navajo Nation that can't be used because as long as you're a woman, you're Navajo, no matter what. Like a woman's clan and race are always Navajo. Even if a woman would marry a black man or a Mexican, if the child is born and it's a woman, she's still Navajo, she still has a clan. And as long as it goes on, then that family is always a girl being born. As far as a generation can go, as long as there's a woman that started with a Navajo lady, it's still going to be Navajo. They're still going to have the clan and being Navajo as a tribe. So that's a Navajo way of defining what a Navajo is. But in the Western world, I don't know how you would qualify, even if a woman that has left the reservation and still going forward somewhere in this generation where she still is Navajo and she still has a clan. To be qualified. Thank you.
I don't know if you have anybody from your ICWA department. Is ICWA falling under social services? Ms. Naabik'iyati? Yes, I do believe it does.
Yes, Honorable Speaker Damon, I can answer the questions.
Okay, all right.
Regarding the Department for Self-Reliance, they provide services to any person who resides on the Navajo Nation. You do not have to be Navajo. They provide services to anyone who applies, resides on Navajo. We do have recognized border towns. An example, if a person resides in Gallup, Farmington, Flagstaff, Page, they can apply for Department for Self-Reliance TANF benefits. If anyone in the household has a certificate of Indian blood. So we do not look particularly at blood quantum, but as long as they live in a border town, anyone who has a certificate of Indian blood, Department for Self-Reliance does provide the full service. Next, on the Indian Child Welfare Act. So if a Navajo child is picked up by any state social services, an example with Arizona Department of Economic Security, if they pick up a child that may be eligible or is a Navajo child, they are required to notify the Navajo Nation that they have potentially a Navajo child in their care. So once we are notified of a child that may be Navajo or potentially eligible for employment with Navajo Nation, the Indian Child Welfare Office, they have a researcher who works collaboratively with
an individual with the Office of Vital Records or Census Office to see if that child may be Navajo. And so they look at the lineage of the parents, grandparents, and of course, talking with the biological parents that were with the child at the time that were asked Navajo to determine if they were Navajo as well. And so again, it's not particularly as a blood quantum as far as their Indian Child Welfare Act office is able to determine that the child has some lineage and connection to the Navajo Nation and who may be eligible, who may have or potentially be eligible to be enrolled with Navajo Nation. Thank you.
Thank you for that response. Any other comments, questions? I'm just Ms. Nezragishi, this is Speaker Damon again. The overall goal, I think, was to, and I think that once Miss Rosalind Gay has that breakdown, it'll show us your overall projection on how much dollars you're actually needing, and that's what we're looking at to see. Okay, this is what your office is looking at and trying to fund, so that we won't leave anybody out, and especially your division on looking in the future and trying to say, okay, this is what she's looking at in identifying for purposes needed, whether it's additional equipment, additional infrastructure, additional data equipment, whatever you're looking at in order for each one of your areas, because as you know, the Division of Social Services has a direct impact on the Navajo people. And when those documents get at, or when we do have those documents, that'll help my colleagues mold and make that decision on how and where we can start budgeting for some of these areas. So I don't know if you included anything in your budget. I just now got a document here. I don't know if you included anything in your budget for like community health representatives. I know that across the whole, you talk to Eugene So, you talk to our Honorable Eugene So, who's been one of the biggest advocates. You talk to a lot of the members on the council. They're looking at individuals like community health representatives and your Division of Aging and Long-Term Care Service Program, and even your daycare service programs in the future when you get students back in. What do you need in order for us to make sure that you keep the workers safe, but you're also keeping the people safe too as well, the recipients on the other end? And I see right here that you have a breakdown of your recommendations on what you're looking at, and it seems like you're looking at about $10.5 million in a request. Does any of that include what I was talking about just now?
Yes, thank you for the questions, Honorable Speaker Damon. And yes, Ms. Rosalind Begay did submit the CARES Act proposal plan. Again, I had mentioned our strategy to implement and upgrade Division of Social Services. So we do have a breakdown for each department within the division, an overall request of $10,567. So we do have that attached. And so we are looking at right now, we're trying to really promote the ability to do telecommute. And the area that we struggle with is that we don't have an automated system. And so we have to protect client records, so we cannot allow the staff to work at home, taking home sensitive client records. And this is where, again, proposing that when we do have to have any pandemic or areas that we have to work out of the office, we will have a secure database. And so that is an area that we're focusing overall for the division. The area regarding the community health representative and the DALTEX, Speaker Damon, those programs are not under Division of Social Services. The CHR and the DALTEX is actually under the Department of Health, who is overseen by Dr. Jill Jim. So that's where my report is not covering CHRs or DALTEX, because that is in another division.
Okay. Sorry. Sometimes I get both of them mixed up there. But on your presentation that you see here, this infrastructure, it seems like it's more built up for data infrastructure. Is that for just your local offices, or do you have any regional offices out there too as well?
Honorable Speaker Damon, yes, we in my presentation I had indicated that we have 58 administrative and direct services offices or centers, like the child care centers. So this, the proposal that we submitted for the $10 million, it is for the 58 offices, meaning direct services offices. An example, the child care programs, they have 24 centers. And so this is where the centers will be equipped with this infrastructure so that they can have online training, so they can be up to date and, doing a lot of on-site training. This morning I did have a meeting with First Things First, and so they're talking about providing training to the workers. So this is where they're wanting to have being able to do virtual training as well. So the staff do not have to close the centers to go off-site for training. So this would be a measure that the child care centers can be open instead of closing for days, every quarter and whatnot. So it's a big investment for the entire division. And we had talked about the wraparound services. So right now, we don't have a database system that we can communicate, as mentioned, the one-stop shop. So if a person comes in and we see, okay, let's refer you to a child care program, you're needing, child care services, you don't have income, let's see if you're eligible for TANF or you're eligible for general assistance. They may say that they're having issues with getting their utilities paid. Okay, let's do referral to LIHEAP for your low-income home energy assistance program. So right now, there's isolations, and this is where we're trying to have a one-stop shop, and we can communicate, and we can get statistics immediately. And that's the focus that we're doing with the entire division of all of the 6 programs and departments. Mr. Chair, thank you.
Okay, great. That community members, any other comments, questions? Or Ms. Naabik'iyati. Today she's an honorary doctorate, Ms. Naabik'iyati.
Thank you.
With that,
I have a
go
comment.
ahead, Honorable Wilson Stewart.
Okay. Ms. Naabik'iyati, thank you for your report. And in reading what you had submitted, under there, right before the third statement, you have on there that the services provided by NDSS, by central government functions, for 98% of your employees have returned back to work and abiding by the return to work plan. And with that plan, how are you dealing with the fact that there are still, I know you said that you have staff out there that have the CPE out there to go and not go in, but to provide assistance to the family or to the children themselves. And then on there, it also states, that you're looking towards the hazard pay, seeking additional funding for hazard pay. Is that also covered in your budget with the $600 million that is there?
Stuart, hold on. Sorry to interrupt you. Somebody's dialing in. Someone's calling. I can hear somebody in the background too as well. Please, colleagues, put your phones on mute. I appreciate it. Chat. Honorable Stewart, the floor is yours.
Okay, so those are my questions. And reading that statement right there, where you have staff going back. So if these staff would go back to work when they are back at work now, and then you have the supplies for them, the equipment for them to do that, is there enough there? Then you also have in there the hazard pay that you need to seek additional funding for the hazard pay. Is that also put in your budget for the $600 million? That's what I wanted to ask in that area. And then also, how much to the T are your staff following this policy, knowing that as leadership, we have heard that the command center had staff that were affected with the virus, and then they had to clean out their buildings. And then I've had some instances where I've been contacted by other employees where a department manager, a division director didn't know what to tell an employee, which guidelines to give them. Yet all they were told was, oh, it's in the policy. How are you making sure that those things are being implemented with your staff if you have 98% of them back at work? That's it, Chairman.
Okay, thank you, Honorable Stewart. Let me go back to Ms. Neswood Kissy.
Thank you, Speaker Damon, and thank you, Honorable Stewart, for the question. And so we do have that return to work plan, and prior to having it disseminated to the staff, we did coordinate with Department of Justice to review that, the memo to the staff. And so I work closely with each of the 6 department program or department managers to have meetings with their staff and how we're going to implement the return to work plan. Regarding the, I guess it's called a special duty pay. It's not hazard pay, special duty pay. And so any staff who is coming into the office, clocking in and out, the non-exempt employees are getting time and a half pay as far as special duty pay since they have returned to work. And then for the exempt employees, they're just giving a straight pay because they are not eligible for time and a half. Now, some of the departments do have sufficient funding for the special duty pay, and so some departments do not have them specifically. And so we would be coordinating with Department of Personnel Management. My understanding, they have some other additional funding that they're looking at to assist some departments or divisions with the special duty pay. So that's where it was not listed in our proposal because some programs already have sufficient funding in that area. Regarding the staff that possibly may be affected with the Health Command Operations Center, yes, that did affect our operation because we are on the 2nd floor. And so the 2 closures that occurred with downstairs at the HCOC, we did have to close our office as well while they did that thorough cleaning. But moving forward, we have had 3 distributions of masks, gloves, what other supplies that we may get from the Health Command Operations Center or by private donors. So we've had 3 distributions to all the staff to make sure that they are, being safe. Majority of staff are not making any contact with family members. They are in the office. They're using telephones, online meetings, and working with families that way. So the doors are not open to the public. And I think that's where it's reducing any type of community spread within the offices because they're not having customers coming in. That's where we have drop boxes. And a lot are done by email, cell phone, where you can take a picture of a document and send it to the offices. And so we have been fortunate that we're able to try and continue business that way. And so once the final executive order is no longer where we have to businesses opening up, we will do a slow transition of opening up offices. We're not going to open the door and have everyone, and we'll have to have precautions in place. So we'll do a gradual increase of individuals coming into the offices, but the staff are there, but the doors are not open to the public. So that's where we're able to help mitigate any type of community spread. And I believe I answered your questions, Honorable Stewart. Thank you.
Thank you, Honorable Stewart. That, everybody else commenting? Mr. Gishi, thank you very much. I really thank you for your staff putting together that proposal, because it gives us an overview on what we can do and start puzzling that into the expenditure plan. So thank you very much for your department for presenting that. Thank you for being prepared, and thank you for your staff for presenting those options. So again, thank you, Mr. Gishi, for being on the line today. We appreciate that.
Thank you very much, Honorable Speaker Damon and honorable other delegates for your time, and I'm always available for any other questions other than just committee meetings. So, feel free to reach out to us or any of our departments and programs. Have a great day and be safe out there. Thank you.
Okay, great. Next, colleagues, we have Ms. Rosalind So from IHS, Indian Health Services. Ms. So, are you there?
Yes, Speaker Damon, I am on the line.
Oh, great. Good to hear your voice again. With that, Ms. So, the floor is yours.
Perfect. I'm unfortunately in a location where I can't send you my report, but I will send it to you, or I'll have one of my staff send it to you because it's easier to reference if you have it in front of you. So from the last meeting, Speaker David, you had asked for a breakdown of all of the funds that have been received by the Navajo area IHS, and then how they were distributed to each of the facilities, including IHS and 638 programs. So that is included in my report. The second area that I wanted to just cover very quickly is, again, all of the efforts related to the water improvement efforts on the Navajo reservation. So I asked my staff to break this into 5 different phases or 5 different categories. The first one, of course, is the temporary watering points that we've been working on. We're estimating that we can start working on a lot of those, and that price ticket that we have calculated is $620,000 to get that completed. Phase 2 would be addressing the permanent watering points, and that we're estimating that amount to be $7.4 million. This is for the 37 chapters that have been identified that need repair or some advanced work related to that. We're estimating that work to be completed within a 2-year period. Phase 3 is the 15 projects that we have reviewed and that are on our sanitation deficiency list, and we're looking at that price ticket of about $13 million. And then phase 4 is the 5 projects that I have already identified in a letter to Bart Stevens, the BIA director. I just pinged him again this morning to see if he has a response for me. Again, the 15 projects in phase 4 are shovel-ready projects that we have been waiting for the right-of-ways to be cleared on that. So we're hoping to get your support to continue to push that. Phase 5, we haven't quite got to that to see how we can, again, look at that and try to make improvements there. Our efforts are continuing to make sure that we rally all of our partners that can help us complete these projects, whether they're going to be securing, Navajo area IHS engineers that we can bring on board or looking at any other ways that we can do this. I've already had conversations with the Army Corps of Engineers to do task order against that, but we'll have to see where which phases that we might need help in that's not otherwise going to be addressed by NECA or NTUA. The third thing that I wanted to raise again for your consideration is the cost of tracers. These are individuals that we need to have once we identify a positive patient. There needs to be what we're calling a tracer right behind that positive patient to interview them, to try to figure out where they have been so we can get in front of other people that may have been exposed as a result of this positive patient. So what we have done there is we have just broken down the cost for that. If we were looking for 1,000 tracers, for example, where we would be looking at a price ticket of $384,000 for a one-year period. And then if we're looking at, so we just broke that down by whatever category that, or whatever category number that we might identify from 100 to 500 to 1,000, and that the cost is broken down in my report that way. Again, this is, right now we're trying to secure volunteers, but volunteers require us to have, it's better to have people that maybe we can pay and train them to be, sorry about that, hold on. So we're looking at, again, the need for these tracers that can help us in terms of identifying the individuals that we're trying to look for. The fourth thing I just wanted to bring to your attention as well, because over the past 60 days, I did have a meeting at one point with one of the delegates, and I can't remember her name right now, but this was the incarcerated patients where there doesn't seem to be a clear definition in terms of or a clear identified responsible party to provide health care to individuals that are incarcerated. And we know that during a one-year period, we see almost 1,800 of these individuals that might be incarcerated and need some kind of health care. Now, if you can understand that IHS has a responsibility certainly for health care, but remember that the Bureau of Indian Affairs is also responsible for the jails, and therefore trying to identify how we cover this population is really important. So we're estimating, and what we're offering up at this point is for 2 years of just seed money that would help us, again, build a program. Again, I'm not requesting that the tracer money or this incarcerated patient funds come to Indian Health Service, rather raising this as an opportunity to consider these priority or needed services for these different programs. So we're looking at a little bit over $861,000 to, again, looking at all the jails on the Navajo Reservation and trying to find a way that we might be able to stand up a program, a medical program or a health program that will serve these individuals that are in this situation. The other thing that I have had meetings about is a medical examiner. I know that this has been raised several times. This is not something that Indian Health Service could do or does do, but trying to figure out how we might be able to look at that kind of a role, that kind of a responsibility, and keeping that work on the Navajo Reservation, I think, is essential in terms of moving forward, especially when we're talking about COVID. Many of our patients have to be, maybe they don't die in an IHS facility per se, but there's no way to sort of trace or track all of the things that they might have been the cause of death. And so having Navajo area medical examiner would be to the benefit of the nation. So those are the things. I don't quite have a cost for that, but I'm glad to circle back around to see if I can get you a cost for that. So, Mr. Speaker, those are the recommendations that I'm presenting from the Navajo Area IHS.
Thank you very much. And that I think that was your breakdown when you do give that to us on I guess the breakdown of funds that will be coming from the CARES dollars to IHS and to each one of the hospitals. I think that'll be a very good topic discussion. I don't know how soon you might be able to get that to us. Ms. So, I know that you said it's going to take some, maybe later on this afternoon, but if there's a follow-up on that, I know there will be a follow-up on that. Can we go ahead and probably set some time, if not tomorrow, maybe even if on Saturday might work. If not, then early next week we would probably look to further having that discussion.
Yes, sir. I will make myself available.
Okay, great. Thank you. So as soon as we get that, colleagues, from Ms. So, we can go ahead and send that out to everybody. With that, is there any comments, questions right now for Ms. Rosalind So from IHS?
Mr. Speaker, you're here. Kealan.
Let me go to Honorable Eugene So and then Honorable Kealan B. Honorable Eugene So, go ahead.
I believe we ask the same question each time, all the time, but I'm going to go try it again. Regards to these positive tested, we've been saying they were sent home. You know, like at the big example is the one in Burnside. Actually, 3 or 4 passed. Those are some of the issues that we have. I was wondering why, if it is the community center in Chinle is working out, it's working out. You know, because I hear a lot on the reservation where people are just sent home after they found positive and back to the families. And I don't believe people really checked up on them also. Because there's a family that I know that I ask, you know, they always ask me, how come they don't check on her? So these are some of the issues. And then there's some many foreign people that told me too, these guys were found positive, but nobody's checking on them or bringing them food or anything. And it's just starting there now. We don't know if they're there or not. These are some of the lot of people outside that were asking these kind of questions. So I was wondering how is it going on? So I'm just thinking they know what they're doing, so I don't try to I don't try to trip them for what they're supposed to be doing out there, you know, with the testing. So that's my question. And the tracers, I don't know. I guess you need tracers, yes, because if people know, how can we follow these people around? We don't know where they are. We don't know who they are. If no, like in Navajo, if we know, then we'll try to help and also try to stay away at the same time, but still help them. You know, if they're tested positive, you know, we know where they are. And it's just because of the Western law where it's confidential, you know, to give out any information on people in there, regards to the hospital or police department or whatever, you know. So those are some of the things. And then another thing I wanted to ask you is how are the health board are assisting? Where are they there? They're collecting some donation, etc., for the hospital or for the people out there that are tested positive? Are they being involved? So those are my questions. And also, I've been confronted so many times by CHO workers that they don't get tested. They don't know why. They're supposed to be tested because they're working with the people out there, taking food and water, etc., to the people that that are positive. Also, they said they'll find out who is positive by hearsay among the people. So that's the only way people know who's positive and who's being in their house, staying home. So these are some of the questions that really involve the people out there, and it's just coming. It seems almost about So many times a day, people would email you or call you, etc. So I just said, no, those people know what they're doing, so I'm not worried about it. We'll all be well one day. So those are the things that it kind of bothers me. I'm not saying you guys are not doing it. I'm just saying why these questions are coming to me, and say, maybe I can answer them. Tell them this is why. Just assist me with this so I can tell them what's going on and why they're not doing this and why they're not, testing some people here and there too. Thank you.
Thank you. Thank you. Go ahead, Ms. So.
Sorry about that. Thank you, Delegate. So I'm going to ask that I get some help to coordinate a meeting with the delegate. I think there's some information that I can certainly help with any delegate for that matter, but I can help, I think, being on the ground maybe Thursday or Friday to see if I can meet in person with the delegate. So if someone can help me with that and coordinate, there is a lot of effort, and I understand that there's an opportunity here for me to help a little bit more if I can meet with the delegate, if that's possible. Thank you.
What, Miss Yazzie, you online?
Yes, I am.
Can you help arrange that meeting with Honorable Eugene So and Miss Rosalind So?
Yes, I can.
Great. Honorable Eugene So, we have a formal meeting with Miss Rosalind So on these issues. So Miss Yazzie from the Speaker's office will coordinate that. So look forward for that information too as well, Miss Rosalind So. With that, let me go ahead and move on down. I do have Honorable Keon Begay and then Honorable Slater up next. Honorable Keon Begay.
Speaker, Santano Sindhi, could had a question for the previous presenter, but so this is Delegate Kealan from the central part of the Navajo Nation again. Could Mr. So, Eugene So, brought up the same things that I wanted to say. And we've been discussing this, but I do appreciate you making contact with some individual that I forward the information to you here in Chicago. And I know you guys are doing your best to help out, but I guess it's just a matter of that the community continues to have questions to say that we're really just being asked to go home and try not to infect our other family, but we don't have it. We don't have a choice. I know. So I should assume that. Now the other question that you brought up. It's not a question. I mean, within your statement, you brought up the medical examiner. You know that through CD 8118, the Navajo Nation Council established the medical examiner under the public safety. The establishment. And then the Law and Order Committee, LOCD 20-18, established the plan of operation. Maybe through your advocacy, working with the Law and Order Committee and the Public Safety, maybe this is a good time to set aside some money for the operation and establishment. And I believe I've been working during the last term, the Law and Order Committee worked directly with the Public Safety and the CI, how it could be established. And they don't really are asking for like a huge building, but just an existing building that they can work out of. That is a bottleneck in getting the family, get their loved one back, but they have to go through the process of getting the body back out off the reservation and then getting it back, and it incurs a lot of costs
besot o yupa ta in aji kenda illa. Koko halet out ikape has on Elia to establish Eliante. But that's just it. Koko maybe through your effort in working with the BIA that tika besot o yun maybe this is a good time and maybe pleading with the council to talk about and setting aside the operation for this particular program, the medical examiner. For the establishment. The plan of operation is already in place. So all it needs is money right now. So this is one area that I want to just make a recommendation, Mr. Speaker, and then Ms. So. Again, like the current Law and Order Committee and the Public Safety, and I'm here to help as well. So, so I strongly recommend that this particular program be set aside funding for the operation. Thank you, Speaker.
All right, Ed. Ms. Rosin, so I don't know if you have a comment or a question about that and a response, basically. Honorable Keon Begay.
Thank you, Speaker and Delegate Begay. So again, as I shared earlier, this is not something that I just generally does, but I just wanted to raise that these are the conversations that I've had, and certainly will do my part to support wherever we can maybe establish these programs or find the resources that are needed at this point. I think that right now, in the situation that we're in, the Navajo Nation, with the support of the Navajo area IHS, can certainly make a strong argument for the support for this program, this type of program on the reservation. Thank you.
Thank you, Marcel, for that. Again, thank you again for everyone that's listening in on the World Wide Web. Colleagues that are just jumping on the line, we are listening to, we did just conclude with a presentation from Ms. Roslyn So from the area IHS Administrative Director. And what she is doing now, she's just taking some comments and some questions from colleagues of the Naabik'iyati Committee. So let me move on down to our next individual, Honorable Slater. The floor is yours.
Thank you, Speaker. Thank you, Director So. I just wanted to ask for clarification because I don't have the plan in front of me, and so it's hard to determine this myself. But how does this help advance the previously funded projects that are kind of backlogged within the IHS system? I understand some of the ideas of farming out work, but with this plan, are we going to be advancing projects that already have money in the bank and should be ready to get out in short order? Thank you.
So, I don't know if you have any comments to
that. Yes, thank you, Speaker. And by the way, my report did go out there to I think it's Ms. Yazzie. I asked that this just be a report to the Navajo Nation Council. This was really our effort to try to put some documentation together for this particular meeting that we're in right now. Delegate Slater, thank you for that question. So I'm not sure that I can answer your question because it's still my question to my staff as to just trying to wrap my hands around this huge list that we have of projects. But what I had asked for before, and I'm going to ask for again, is that I'm asking for some body of members, maybe 4 or 5 members from the 24th Council to help me review this list and prioritize this list. And because outside of that, it's hard to, well, it's not hard, but that is what I think will help us develop the plan that we need to have, because I don't know. I mean, we're looking at sort of just the immediate need and not looking at the comprehensive list that we have in front of us, and that's still my concern. So we started to work through this first step, this first phase of looking at the watering points, but that's not addressing the entire need for the 9,000 homes that still need a watering, that need water source. So I'm still struggling with that, and I'm going to ask again that I have some members from this body that help me take a look at this, some very knowledgeable people about all of this, and really look at streamlining the process as well as putting a dollar figure and a timeline to all of the things that we're trying to do. Thank you.
Great, thank you. And I think that Ms. So, if you want to have when you do come here and you are here in the vicinity again, Ms. Yazzie, I guess you'll be working on that. We can sit down with you two at the speaker's office and start strategizing on some of those initiatives. And if there's anything else we need to bring in from our partners in the executive branch, we can invite them to really try to pinpoint some of these realistic goals that we can start realizing, and more importantly, how the nation can still help assist in meeting some of these deadlines that are obtainable over the next couple of months, and maybe possibly put some timelines together so that we're relatively working and coherently in trying to make sure that we get the best possible services out to the people. Colleagues, any other comments, questions?
Speakers, Vice Chair Smith.
Vice Chair Smith, go ahead.
Well, thank you, Speaker. Thank you, Ms. So, from IHS. As you well know, we're all listening, and we know that the pandemic has hit us very, very hard. And I hear that in the next round, coming winter, it's going to hit even harder. And if that's so, and our numbers are even beyond New York in the cases, what is the federal government, IHS, how are we prepared for that? Yes, we got that $600 million that we need to spend. Yes, we want to use that correctly. However, I'm thinking as this pandemic is continuing, it seems like we're not even flattening the curve. Is IHS thinking about building more facilities? We're at capacity. And if the numbers still are going to be increasing daily, we're at 4,000 some odd numbers now. And daily we get reports, and the numbers don't seem to be declining. So my question is, are they going to be building additional clinics, additional hospitals? And Gallup was supposed to be built many years ago. GIMC, is that going to be built? And when will that be built? And also we have 638. Now, Dudley, the clinic has been closed. We need services. We need medical facilities. Folks are talking about toothache, and nobody wants to help them. How do we facilitate that? I know we're focusing on the COVID-19, and folks are kind of reluctant to go in if they have an injury. And they're saying, I don't want to go in. I'd rather suffer and wait it out. And they may have a broken bone, or they may have a sprain or an injury, or some kind of minor medical non-emergency, and they're saying, no, I don't want to go in because I might catch COVID-19. So this is something that I'd like to have as an answer in the long run, Speaker. And I don't know who can answer that question if we're still waiting for 6:30 to get back on board from that disease and why they closed down that clinic. I'm still getting texts. I'm still getting calls asking why. So that's my question, Speaker. Thank you.
Okay. That I don't think you might not have any information on that. Do you, Ms. So? On the closure of the Hudsville's clinic?
I do not have any information on that. That would be a 638 program. I can say, though, on the Indian Health Service side that we have not closed any facilities. We have reduced services, and we're now looking at slowly opening back up some of the services that we had reduced earlier. So I can share that information. Thank you.
Okay.
Sorry. I can just talk really quickly about GIMC. So GIMC, again, as I've shared earlier, that is still with the Navajo Nation president, and we're looking for either some kind of a move forward on. There's still two sites that he wants considered. One is Rehoboth, and the other one is Fort Wingate. And we're going to phase 2 of the site evaluation on that. And so once we hear back from the president, then we can figure out how we're going to move forward on that. Thank you.
Great. That, colleagues, any other comments, questions?
Delegate Daniel. Speaker, this is Thomas Walker.
Yeah, hold on. I got Vice Chair Walker. Who else do I got? Is it Chairman Sue?
Delegate Brown.
Okay. Anybody else? Honorable Brown, or Chairman Sue, Honorable Walker. Anybody else?
This is Delegate Slater. I have one more question.
Okay. That, let me go on to Vice Chair Walker.
Thank you, Speaker. Colleagues, staff that are assisting with this call this afternoon, and then the audience, everyone that's listening. Director good afternoon. Thank you for the report. Thank you for giving us a really good discussion here this afternoon. Your questions and then your responses, comments, and sharing of information. Thank you, Barkin, sincere. This morning we had a call with United Healthcare of Arizona and talked about a number of possible ways they can assist the nation because they were offering, services and resources and so forth. So they engaged us for a couple hours, and I appreciated that conversation with the private sector as far as healthcare is concerned and how Navajo could possibly be given some assistance and resources. So I have a question to Director So. Ada, as our trustee and as the federal healthcare system on Navajo, and then of course in Indian country, Ada, could you team up? Could you partner up with some organization like United Healthcare of Arizona to assist Indian Nation, in this case Navajo Nation, to address COVID-19 pandemic in various ways, especially the areas of testing and contact tracing, and then possibly other ways that
can be of benefit and help to the Navajo Nation for relief, as well as prevention and even direct support to COVID-19 patients. That question, if you can give me a response, and I would really appreciate that. No, that's one. Second is I want to, again, I said this morning on the call, which is the southwest portion of the Navajo Nation, namely the Winslow Indian Healthcare Center's service area, the eight chapters that it serves. Local leadership and constituents are asking for a testing blitz to be conducted in our region. So, and I did write a letter last week. You were on that. You were one of the addressees, as well as Navajo Nation and Speaker's Office, although the Incident Command Center. I would like a response to that. It doesn't have to be on this call. We appreciate a response written to the request. So the Navajo Nation, the Navajo people have all these healthcare stakeholders, as we all know and are familiar with. So each has their own resources, their own way of governing. Each probably has their own priorities, and they all have strengths and, of course, weaknesses as well. But together, that's I see nothing but strength if they unify all these health stakeholders that are supposed to serve the Navajo Nation. Each one separately, independently, like I said, they have challenges, but together, then of course that's the that they probably can do more than our expectation. And I'm not saying that they're not doing that, but my expectations are that they would do that and then continue to do that, and beyond that, that's the only way to do it. Provide support to the Navajo people during this pandemic, and not independent and not have different priorities and so forth. So I want to say that now this afternoon. That's the second area I want to mention. The third is Navajo. There's no reason why we should not work towards a testing facility, to be where that's located, where that's out of that facility, testing can be conducted and records can be kept, and it could even be a research laboratory for the future. So I think it when I go around to the different facilities on Navajo, I see how our hospitals create and they make these makeshift respiratory clinics. So like tents, trailers, mobile units are out there being used for sort of like a makeshift facilities and equipment to address COVID-19, and that's what we could do right now, certainly. But how long are we going to do that? It's time to probably go conduct some feasibility study to create long-term healthcare in this area, areas of pandemics and disease control and so forth. We're a big enough tribe to sustain something like that. We have the user population. I want to say I would not like audience to look at that and think about that, because I'll bring it up again later. With that, thank you, Speaker.
Thank you for that information. those remarks and the questions. Ms. So, do you have a response?
Thank you, Speaker. So with regards to the United Health of Arizona, as I've shared before, we have a number of partners that we are already working with. So if we can, I can ping you offline if I could, just to see what that conversation was about and what they're offering to work with us and coordinate with us. We have over 200 volunteers that are in the Navajo area right now. These are generally health professionals that are in the area right now, all the way from the VA to HHS, to COVID care volunteers that we're working with. So yes, we can definitely work with people or work with private entities to try to, again, do the work that we are trying to do. So if I can get a little bit more information on that, I'll be glad to do that. With respect to the testing blitz, this I asked again yesterday that we have revised our testing blitz. I was hoping that this information would be put out by the Unified Command Group, but I haven't seen it quite yet. I know that we do now have supplies that are flowing into the Navajo area that allows us to do more testing. So I will follow up on that one and provide another update on where we are with an updated schedule. And our goal is to get out there and to do more testing through all of our facilities that we have. Your comment regarding a facility, definitely this is probably the right time to be looking at some of these opportunities and our needs as we move forward with regards to COVID. The comment that was made earlier that in the fall we're probably looking at something similar to what we're dealing with right now. It is my hope that we have learned a lot from this, from what we have experienced to date, and that we can be even more prepared in terms of being able to address what might come in the fall. The one caveat that I would say is that we're also planning to look at how we're going to address just the normal flu seasons that we're going to have to deal with. As you know, many of the symptoms are the same, so trying to navigate and prepare for that is crucial right now. And in spite of everything that we're going through, we're already looking at the future to make sure that we are as prepared as we can be. Thank you, Delegate Walker.
Thank you. So we'll move on down to our next individual. This is the lineup. I have Chairman Daniel So, Honorable Brown, Honorable Slater, Honorable Otto So, and Honorable Paul Begay. Chairman So, go ahead.
Thank you, Speaker. Otto, colleagues on the telephone calls, and Ms. Lenso, thank you for always being open to providing updates, no matter the day. Thank you. Basically, there's a press release that says that Admiral Michael Wiaki was on the Navajo Nation. And I was wondering if you have, I guess, a summary of what his visit is about and what he's looking for, and basically what ideas did you present to him that possibly the council, the committees of the council could also help you reinforce and help you advocate for the needs that you relayed to Admiral Wiaki. The other is we also got email copies or copies of the fact that Senator Martin Heinrich basically asked the Admiral to do a more in-depth site review regarding Rehoboth. I think the committee has already said that, the Fort Wingate facility still needs perhaps remediation, reclamation, since it was formerly a military reservation, and there may still be live ammo on that particular part that was given to the Navajo Nation. And perhaps it might even be turned into a Superfund site, which would basically then allow no development until cleanup has occurred. So that was then the thought that we had regarding Fort Wingate. So if you could give the committee an update on the Gallup Indian Medical Center. The other is in last week's report, you also highlighted that Pueblo Pintado Health Center was still over in the president's office on whether it's going to be whether president is going to choose to make it a 638 project or to leave it as an IHS project to where IHS would oversee the construction. I'm wondering if you have any further details on that particular aspect. Other than that, I know that you're multitasking all the time, and I think that basically keeps everybody on the committee on their toes to see what the things that IHS is really evolving to be under your leadership. In years past, IHS was an immovable. It was a ship in the desert that couldn't be moved. But for you, when you've come on, you've really changed, I think, the character and the personality of the IHS on the Navajo Nation. And we really appreciate what you've done in the short time that you've been back on the Navajo Nation. Thank you.
Thank you, Chairman Zoe. I don't know if you have a response right now, Mrs. Rosalind Stowe.
Thank you for that. And again, good afternoon, Chairman. So it's nice to hear your voice. So with respect to Admiral Naabik'iyati, I'm actually traveling with him. I was with him yesterday at Gallup Indian Medical Center, and then with him today at Shiprock, and we'll be with him tomorrow at Crown Point. So I understand that this is the first time that the Admiral has been out to Navajo country, at least in his capacity. So it's been a great opportunity to message to him the work of the Navajo area IHS, particularly during this pandemic, as well as all of the things that the Navajo area IHS staff have done. So that has been first and foremost my message to the director. He's heard a lot. You know, it's challenging sometimes to be 2,000 miles away from where the action is going on, and it's hard to understand and appreciate just how complicated, challenging, difficult, all of those adjectives that can describe what we're going through right now. So it is my hope that we have been able to message to him that there is a lot of work, there is a lot of coordination, there is a lot of dedication on behalf of the Navajo area IHS, and also working very closely with the 24th Council as well as the President's Office. And to that, Delegate Crotty was able to join us today, and I'm asking delegates to join me as well tomorrow in Crown Point. So hopefully they can make that visit worthwhile, because it is very important that we have a chance to to message to the IHS director just everything that is going on. And he also had a chance to meet or talk with the governor of New Mexico this morning. So again, a lot of coordination and education going on that I hope benefits us in moving forward to just appreciate how difficult some of the things are that we're dealing with. And so we will continue in my next day and a half, continue to give him some information and also let the staff talk directly to him so that he can get the firsthand information from them. So that has been my primary objective for this visit. For his visit, again, I think it's really just being boots on the ground, but getting a better understanding of everything that we're dealing with. So with regards to the GIMC, again, that is moving forward in the sense that I think it was the 15th that I signed off on the final POR, which is the program of requirements for Pablo Pintado. I did meet with the president yesterday and reminded him that I'd like to move that forward if he does not choose to exercise 638 to do the planning or the design and construction of that facility. So I will meet with his staff later today to talk about both GIMC and Pablo Pintado, so I will bring that up again. And so with respect to the site review, again, there have been multiple, well, you all know this, there have been multiple sites that have been identified and reviewed at phase 1 for GIMC, and Rehoboth continues to be the top evaluation or meeting. I think even this last time it was unanimous by the Navajo Nation partners that were involved in that evaluation of the site. So what we need to do now is make a final determination of how we go forward from here so we can get to phase 2. What's important about that is it depends on how much land we have in Rehoboth or whatever site that we go with right now to be able to start planning and designing what the facility will look like. And that has to be built on, or that has to take into consideration how much land we have. So I will continue to push that. I've also asked my staff to move forward on Botaway Gap as well. So we'll be working on that one very, very soon. Thank you.
Moving on down. Honorable Brown, the floor is yours.
Ayate, thank you, Chair out of 24th Navajo Nation Council. Thank you, Director So, for your presentation and for your responses. First of all, I'm still trying to help Kanta IHS coordinate a testing blitz for our area. I still have a lot of our people in our region asking for testing in Kanta and Western Agency. The first question with that would be, is it easier for hospitals and clinics that are 638? It seems like they are more creative in bringing testing kits. My understanding is testing kits expire soon after their shelf life is very long. So with that, I hope that we're using all the test kits that were donated from the multiple organizations. So I know it seems like your direction for non-638, which Kayenta is, you're directing, I don't know if it's you or on the Navajo Nation Incident Command Center's 213, I guess navigating through all of that, they have to go through the Incident Command also first before Kayenta gets testing. I'm working with Ms. Plummer as well as there's an organization, Premier Innovative. They want to give 3,000 test kits, but they're afraid that by the time it gets to Kayenta, those test kits will have expired or they will no longer be effective. What's the process and how long does it take for it to go through our system? And then the other thing would be, right now, is IHS or any companies, hospitals, clinics on the Navajo Nation testing for antibodies? How are we looking at different types to help our people who tested positive? And the next question would be, when you send, when your facilities, doctors, send our COVID positive patients away who feel like they're, I hate to say this, when they feel like they're knocking on death's door, they're told, go home, there's not enough beds, and then they go home because they have really no fight left in them to fight IHS. And what is it that you send them home with? If you can send it to the 24th Navajo Nation Council, I know there's usually discharge documents, just in general, I'm not asking for patients' things, but in general, usually what type of medication do you recommend? How do you recommend sanitizing? What packet do you give them to ensure that they're getting the best care when they go home? Mind you that in a lot of people, you know, they don't have people like CNAs or nurses in their households. So they're doing the best that they can with a very limited medication. With that, are you sending them home with medications, or is it just ibuprofen that you're sending them home with? What type of medicine and advice are the doctors giving? And finally, I want to make this known that in Kayenta, there's a doctor there, and I'll follow up with this, that I feel I've been hearing, even before COVID, has been very heartless, just not really caring. And my understanding is that IHS has been sweeping some of our deaths that came IHS under the rug and not really following through some of these deaths. So if we can talk about that, and I want to have a meeting with you on that also. I'll bring some names and I'll bring some incidents to you. And I think we need to bring some sort of remedy to Kayenta. Maybe that's why we haven't gotten the testing out yet. And then and then on the Navajo Nation side, I was told today that I have to work with the Navajo epidemiologist, and that's to do the follow through or the trace test, or what is it called, the contact tracing. And there's other organizations that are willing to do that. So I've been looking high and low on my own, trying to get testing to Kayenta and for the surrounding communities also. So that's still, I know the last time when we had a conversation a couple of weeks ago, you said you were going to check into this, and you kind of mentioned that earlier. So if you can make that information known to us, I would really appreciate that. Thank you for all your work, all your team. I know you guys are trying your best, but here, being at the grassroots level, and another thing, it would have been great if the Admiral, I know, very short time, it would have been great if he would have been at the first ground zero and to see the lack of the doctors and care that we're having in Kayenta. To have Admiral see that would have been really good, maybe the next time. But in the meantime, I'm going to continue to advocate and do the best that I can, because just this morning I was just on a call trying to assist a family on funeral arrangements again. We are lacking, one of our backhoes broke, so now we have 3 chapters trying to share one backhoe and assistance with, and Kayenta Township with the lack of operators also. So we're trying our best also, and it is heartbreaking when we are in the communities and we have our relatives dying, and we're having them being turned away also. So these are people that are sharing their information with me, and I follow through with them also. So I'm trying to keep in contact with them and see how we can. And the thing is, I'm not trying to find fault in IHS. I'm just trying to find ways on how we can help bring remedy and solutions. Ultimately, I feel for our people. So thank you. Yeah.
Thank you, Honorable Brown, for those questions and concerns. More importantly, the concerns. Ms. So, I don't know if you have a response to that, or if you just want to maybe schedule a meeting with Honorable Brown.
Thank you, Speaker. Yes, I'm going to reach out to Delegate Brown to see if I can address some of the issues that he has. Certainly the provider issue is concerning to me, and we need to address those sooner than later, as well as improving the testing capacity out there. Just one thing that we want to make sure that I want to share on the testing. So there's two ways that we can test in the Navajo area, and so we need to make sure that, number one, those test kits are the same ones that we can use in our facility. So that's essential to make sure that we're coordinating very well. And then we want to make sure also that there's no, that is a donation to the Navajo area IHS. And so we have to make sure that there's no strings attached, meaning that the donator doesn't want results or things like that. So we just need to make sure that we're clear on how we accept donations from private sector or anyone. That's for everything, anything. The federal government has a very clear policy on how we accept that. But nonetheless, if there is something that we can do with the test kits that are being offered, we want to be able to do that. But equally important, remember that we do the testing, we need to have the tracers, and then we need to have the isolation units. Those have to all be in place for us to do the best that we can for mitigating the any test results that we're dealing with right now. But I will follow up with Delegate Brown. Thank you very much. Thank you.
Thank you, Honorable Brown, for those questions. It looks like Ms. Yazzie, if you can help coordinate that too with Honorable Brown and Ms. So, that'd be great.
Yes, I can, Speaker.
Great. That, moving on down. Honorable Slater, floor is yours.
Thank you, Speaker. Thank you, Director So. I had a couple more questions. First, on attachment 1 in the presentation you provided under 305, it says NNEMS, NNHMS, NNNTCCTF. Can you let me know what the HMS stands for? So that's one question. And then second, you mentioned there were more tests coming in. It sounds like there's a more comprehensive testing plan. Can that be emailed out to the delegates? And I keep hearing just oral reports, and I wish there was something concrete and writing that we could reference that will inform us where they're coming from. Is it private organizations, the federal government, is the Navajo Nation that's procuring them, to really understand how resources are flowing to the nation, and then how they're being distributed within the nation. Third, is the curve flattening, or has it flattened, as was publicized yesterday? I would like to see maybe the surge projections or a report from your office that could help inform council and policies that we're considering right now for the $600 million. And then lastly, the numbers that seem to be in the top of the report show potential appropriations, and I don't think it clearly identifies whether the Navajo Nation or Navajo area IHS would be bearing the cost, or whether there's a proposal to split the funding between the two. If there's some clarification on that end, I'd really appreciate it, so that we can understand what the expectation would be of what IHS can deliver and would need the nation's help on. Thank you.
Ms. So, I'll go ahead and hand the floor back over to you.
Thank you, Speaker. Is it possible, Mr. Speaker, that we could set this report up for a separate conversation? Again, as I'm saying, I was traveling and trying to look at all of the information that's coming through, but also wanted to give what we could give to you. So some of these abbreviations, I think we can do a better job at in terms of for example, the first line there that talks about GRSSC. That's our Gallup Regional Supply Center. So I can do a better job at sort of clarifying some information if I can, maybe on just a short follow-up call if that's possible. And then just to let you know, there's nothing there's nothing in here that is concrete. That's why I wanted to make sure that this report is only for the delegates. This was our first I was asked to put together sort of budgets, estimates, timelines, and those sorts of things from the Speaker's office, and that's what we were attempting to do. So, and Delegate Slater, I will follow up with you just to make sure that I'm specifically answering your questions as well. Thank you.
Okay, definitely we can do that. We can have a follow-up specifically on that, and I know that time is of the essence too today. Colleagues, the time now is 2:49, and I know that So has to attend to another matter. Maybe almost later, we'll set that up with a time for her to specifically go over that document. Maybe as soon as possible, as early as this weekend. As indicated, she says she's available. Ms. So says she's available, or as early as next week, maybe on Monday, if there's nothing else going on. But let me go ahead and go to Honorable Otto So and Honorable Paul Begay. I do have you two on the line. Ms. So will be having to leave here shortly. So if you would ask your questions as quickly as possible, and then we can go ahead and let her go. Honorable Otto So. Going once. Going twice. Honorable Paul Begay.
Thank you, Speaker, and thank you, colleagues who are calling in, listening. Thank you, Ms. Robinson, for your report. I was going to mention what happened to Botaway Gap, but you brought that up, so I'm happy that we're still in there. Also, we did talk a while back about Page area doing one of these tests for Tachi'i, possibly Kaibito. That has never amounted to anything. When I spoke with the mayor of Page and the CEO of Banner, it really sounded like it was going to happen 3 to 4 days. But it's been like 3 to 4 weeks now, and I haven't heard anything from them. So I know that every place else, we're all wanting testing done for our people. And this was one of the hardest hit areas was the Tachi'i and Kaibito inscription house, copper mine area. It still is today. We want to know about tracing and as many as people that we can get tested. I think that will help us to do better and in flattening the curve. So thank you again for your report. Thank you.
Oh, I don't know if you want to respond to that and probably do some closing remarks, Ms. Roslyn. So then you can go ahead and review.
Thank you. Thank you for that, Mr. Begay, as well. I will loop back around to the Page situation and see if we can get that moving back and get that back on track. And then again, I'll also continue to keep the 24th Council up to date on all the facility projects. That is something that we need to stay focused on as a Navajo Nation, as well as our responsibility from the Navajo area IHS. There was a question earlier about the curve, where we are in that process, and I will say that it's I see some more positive results now in terms of our ability to get in front of this COVID-19, and here's why. Probably towards the end of April, our facilities were almost maxed out with our intensive care rooms, our hospital rooms, and so forth. Every day we track our bed availability, our bed space, and that's how we determine who might be on a ventilator, who need to be sent out because they need a higher level of care, and so on and so forth. And so that's starting to come back. That is coming down, in that while we still see positive cases, that doesn't mean that there are people that are ending up in the hospital. So there's two separate factors that we're trying to evaluate. Is that certainly we don't want any more positive cases than we have right now. But the more we test, the more we're going to learn who's positive and who's not at any given point. But those other factors, I think now that we finally have isolation space available to us, we've had it available for 2 weeks, it's finally been announced. And so we can, again, help mitigate the situation by providing people space or a place to go if they don't have any other place to go to self-isolate. So when we're looking at when we're looking at statistics, we're looking at making sure that our hospitals, yes, they're busy. They're always going to be busy, but they were not at the level. They are not at the level as they were towards the end of April. Those are critical points to try to evaluate in terms of the number of cases versus what we're seeing in the hospital. So that's sort of telling us is that people are testing positive, but they're not requiring hospital care, which is the good thing. But that also still means that we have to do all of those other mitigating factors, the shelter at home, the quarantine, or not the quarantine, but the weekend curfews. Those are all working. Those are all working because if you look at those charts that we put out at the beginning of this, and that was sometime in March when we put those, you can see where we are in this process now and that we are starting to see some changes there in our numbers. So I hope that is helpful. Thank you so much for, again, giving me the opportunity to talk with you. Many of you have my cell phone numbers. I'll ask Ms. Yazzie to send it out again. If you have any questions, please do not hesitate to contact me. I'm more than happy to help you any way that I can. Thank you very much.
Thank you very much, Ms. So, for that call and for you calling in, and more importantly, listening to my colleagues of the 24th Navajo Nation Naabik'iyati Committee. And thank you for being part of our agency calls. For that, I think that's you and your staff being a part of that. Anytime we call to ask to see if you can do an update, you're there, to willing and helpful. So thank you very much. And as Daniel so indicated, you changed the makeup and face of IHS here. So thank you for you and all your staff that's out there on the front lines, being out there for us and working with our people again. So again, thank you very much for being on the call today. With that, colleagues, I don't have anybody else on the agenda today, except for 638 hospitals. This is next. Moving on down. Is there Ms. Yazzie? Who do we have on the?
I think that Dr. Jill Jim is on the line right now. She's on the call as well.
Okay, great. Good to Dr. Jim. Jill Jim, how are you doing? It's not. Ms. Yazzie, was there an update from the 638 hospitals? Did they have any presentations today?
No, they didn't. I did. Hello, this is Dr. Jim.
Hello, Dr. Jill Jim. Hold on real quick. I think there's a 638 hospital.
Honorable Damon, yes, we do have Christopher Curley and also Mr. Virgil Davis to do a report for 638 on our healthcare top 5 priorities.
Okay. Do you guys have a presentation?
Mr. Hanley, Mr. Virgil Davis wants to get on the floor to present.
Okay. Let me do this. let me go ahead and reach out to Mr. Hanley, see if you can send out that information. Secondly, Dr. Jill Jim, thank you for being on the line. I know that we were expecting you to be on the call this morning, and we're looking forward to listening to a presentation from you. Are you able to do a presentation?
Yes, just a brief one.
Okay. Do you happen to have a presentation?
Presentation or verbal presentation there.
Okay, hold on real quick. Let me do let me go over to the 638 first, Dr. Jim, and then I'll come back to you. Is that, are you good with that?
Oh, Abigail. Yeah.
Okay, great. Okay, that I'm still trying to track down the staff, see if they sent that out to.
Honorable Speaker Damon.
Yes.
Yes, sir. If you don't have a document, is there another time that you would like us to present? Because we did send this to Mr. Hanley and also to Dr. Jim as well. So I think it would be better if we have the documents in hand, also to all the council delegates, because I believe that this is important enough to address, to have everyone on the call, especially the council delegates, to look at the documents and then be able to make a presentation to the council in that manner. Sure.
Okay, we're getting that information right now.
Okay. So do I have the order?
Yes, go ahead.
Okay, thank you very much. Again, Honorable Speaker Damon and also members of the council, I appreciate the call and the invitation to the Nabi work session as well. Thank you for allowing us to give a presentation on behalf of the 638 Association, and also my colleague Mr. Virgil Davis will be doing the general presentation. So in that respect, I just want to say thank you. I serve as the president of the 638 Association, also the president of the Cuba City Regional Healthcare Corporation. So again, just want to say thank you and allowing us to do a presentation, and hopefully that we'll be able to present to you the top priorities from our 638 Association that are within Arizona and also New Mexico on our satellites. And on behalf of them, we'd like to, again, hopefully we can get some of our funding out to these organizations, which is much needed at this time. Mr. Speaker, I'd like to ask the floor to be given to Mr. Virgil Davis, Winslow Chief Operating Officer. Thank you, sir.
Go ahead, Mr. Davis. But actually, colleagues, staff members, individuals on the line, if you're not speaking, please make sure your phone is on mute. Thank you.
Okay,
Mr. Davis?
24th Council, Shinet Ani, Che Virgil L. Davis, Yenashia, Kis Ani, Shleto Bahabashichi, Pima Dashichedo, Tachini Dashanala. I'm Virgil Davis, the Chief Operating Officer for Winslow Indian Healthcare, and I'm working closely with Mr. Chris Curley, the President of the 638 Association. We were requested to provide documents and a format budget request to the council for use of the $6 million $600 million for the COVID outbreak. So we wanted to ensure that the 638 also deserves some recognition, but also to help mitigate COVID by having the resources to expand and strengthen our local capacity to respond at each of our facilities in Arizona and New Mexico. While we do recognize COVID, we identified 6 factors that from a 638 perspective with regard to working closely with our partners from Navajo Area IHS as well as Navajo Nation Department of Health and others. But we want to make sure that ensure that the Navajo Nation Public Health serves as its first responder and that we serve as a trusted community resource to provide timely, accurate, and culturally sensitive public information and risk communications. So currently we are doing that daily amongst the 3, Navajo Nation, IHS, and 638. While there are no medical countermeasures, antivirals or vaccines to address COVID, we're relying on the public health ability to identify, quarantine, and monitor those high and medium risks for COVID by isolating and testing those with the symptoms and identifying some cases that need to be followed up with our healthcare partners, either under IHS, 638, or with the Navajo Nation. While we do recognize Navajo Nation Public Health through the Navajo Department of Health, who has the legal authority to implement voluntary and mandatory isolation and quarantine, we find that significant to honor and recognize that public health authority. So 638 does follow that authority as we communicate within our own organizations. The 4th, codified by state and tribal laws, regulations, as well as federal, we understand the authority to collect patient information necessary to investigate cases and contact necessary to respond is very significant and important. And we try to do our due diligence by making sure we don't compromise HIPAA or Privacy Act of our individual patients who are seen at our local facilities, not only in 630, but also with Navajo Nation as well as Indian Health Service. We also recognize that Navajo Nation works closely with healthcare providers at all 3 locales, be it IHS, 638, or Navajo Nation, to provide frontline guidance to ensure that we have infection control and occupational protections in terms of PPEs and supplies that are needed to combat COVID. And lastly, we are trying to ensure that we have a role in readying and providing expertise in healthcare systems, emergency medical services, businesses, law enforcement, other sectors in implementing guidance and looking at mitigation measures in all these scenarios. So we want to make sure that our perspectives are at least annotated on record. While we do recognize that we get annual federal funding support and we partner with IHS and Navajo Nation, we want to make sure that the council recognizes that a lot of our funding is becoming exhausted, and so we are using those exhausted funds to address COVID, but we're also applying through grants and other funding mechanisms. So with the request for what the 638s have asked for, we are looking at three areas that for 638, we're looking at prevention. We're looking at funding 638 to take measures to help prevent the spread of COVID. We've identified our budgets based on environmental and cleaning supplies, such as disinfectants, soap, spray bottles, hydrogen, etc. We're also looking at a need for more personal protective equipment, such as examination gloves, face masks, eye protections, disposable gowns, coveralls, disposable boots. We're also looking at equipment associated with quarantine and isolation to include test kits that monitor community blitzes for patients and staff. We're also looking at infrastructure such as purchasing modular double-wide for hosting PHN CHR staff to coordinate wraparound services, counseling, investigating cases, testing, monitoring. But we're also looking at infrastructure where we need building infrastructure to some of our local clinics as well as some of our hospitals for 638. We're also looking at training and educational programs and materials geared to our personnel and the community on pandemic fundamentals, response strategies, and mitigation interventions. We find it's important that we address all of these communications at all levels, the elderly, the adults, as well as the youth as well as children so that they understand the impacts of COVID and that it's impacting everybody at all age levels. The second part is COVID preparation. We're looking at funding to support proper planning, staffing, communications that ensures effective operations and maintain the safety of our patients and our staff and the communities. We're looking at funding to conduct and develop crisis response plans, policy development for public health and community health emergencies, such as looking at response plans, at-risk population planning, etc. We're also looking at our organizations to be sufficiently staffed to remain operational 24/7, looking at offering some overtime pay, looking at hiring temporary or contract staff or consultants, more so for ER, emergency room, which includes doctors and nurses, making sure that we maintain some of our permanent employees by making sure that they don't burn out, but also making sure that we take care of our own staff. So we are requesting funding in that regard. We're also looking at funding a lot of our technologies available for remote communication, such as telehealth. We're looking at servers for telehealth. We're looking at currently upgrading our D3 to fiber optics, improving our data analytics and epidemiological surveillance system capacity, and just basically following up our patients by our providers. And lastly, technological funding to purchase IT equipment and software that can host multifunctional activities, print services, teleconferencing, and video, because that appears to be the norm that is happening for 638 Navajo Nation IHS as we communicate daily. And then lastly, our COVID response. We're looking for funding for departments, our 638 organizations to take many of the measures to respond to the spread, to mitigate. So we're looking at patients and staff who experience severe symptoms resulting from COVID. We're looking for funding to help us with medical visits, emergency department visits, and hospitalization. We're looking at funding to purchase medical and first aid supplies, and also funding for medical transportation. And lastly, we're looking at purchasing supplies for monitoring and testing, as well as proper course of action. And testing includes testing kits, backup analyzers, laboratory supplies to include reagents and consumables, specimen tracking and transport, antibody testing, pharmaceutical and non-pharmaceutical interventions. So each one of the 638s that we communicated outward provided a dollar amount of how much money they're requesting. So in your document package, Winslow has identified their breakout at $32 million, Utah Navajo $7 million, Tuba City Regional $910,700 million. However, there is a notation we put in there that $900 million is had already been requested for a new hospital for Tuba City and had been requested separately to Nabi and Shashin funding in separate actions. Pine Hill Health Center has requested $10.4 million. Fort Defiance Indian Hospital has requested $131.5 million. Alamo, $17.8 million for a total of $209,568,000. But if you include the $900 for Tuba City's request for a new hospital, it comes up to $1.1 billion, which is approximately $500 over the $600 million that has been requested and asked of each organization to submit requests. So that is the update that we have for 638. We do appreciate your time and your understanding and listening to what we have to offer under 638, how we are trying to mitigate and overcome the COVID in our respective communities in Arizona and New Mexico. So with that, I'd like to yield this back to Mr. Curley, Chris Curley.
Okay, thank you, Virgil, Otto, and members of the council, and Mr. Honorable Damon, for allowing us to present. As you heard, some of our priorities, they all vary and from different 638s as well. And I know that a lot of it, especially with Tuba City, we're looking at fiber right now. Tuba City is looking at only working on microwave as far as communication. So one of the priorities that we're looking at is hoping that we can be able to draw something for each 638 out there
and to be able to have the council, whether they need to, I don't know if we need to do a legislation to get some of the funding out to 638. That will be something I think would be something to help out our frontline workers out there and our staff that are working tirelessly for like the last 9-10 weeks continuing. But I think that with our actions and lockdowns and sheltering in place, I think a lot of it's going to be something that we look at to helping flatten the curve. Mr. Damon, thank you.
Okay. So that concludes your presentation.
Yes. Yes, sir.
Okay. Is this, I'm just looking at one of your documents here. I'm just trying to clarify for reference. This is for each individual 630 hospital, I guess, has their, you reached out to them and this is some of their initiatives or requests. I really like the like let's take Winslow Indian Health Clinic. Their overall request is for additional $32 million. Is that what I'm looking at? And then Rama is just looking for a vehicle.
Rama is looking for vehicles. They're looking for gravel and road improvement. They're looking for internet towers and radio. They're looking for a warehouse. They're also looking at HVAC systems to be installed. They're also looking for PPEs, and they're looking at an EMS substation at the Raymond Navajo Detention Center to be completed, and then they're looking at an ambulance for respiratory patients.
The only thing I see from them on here is a vehicle. That's why I asked that. Oh, okay, I see it. If you scroll down some more. Okay, 17.8 is what they're looking at. Oh, no, that's Alamo. And then the whole thing's compiled onto this one document, the 638 document, I guess.
Yes.
And that's the one that's dated 638 Association for Indians of Self-Determination?
Yes.
Okay, so that's the document, and that's additional funding you're looking at right now. Do you guys have a breakdown of how much money you received from the CARES funds already?
No, we have not, but we can request that information from each of the individual 638 to show that funding information in comparison to the additional requests that have just been presented.
Okay, because that's something my colleagues were asking for. It's like, how much money did the 638 hospitals get, and what is your parameters of spending those dollars on? And I don't know if those dollars have already been budgeted out at each one of your hospitals. But that would be really good information for my colleagues to have as well.
Okay, we can do that. Thank you.
Okay, great. With that, colleagues, any questions for regarding 638 hospitals? I don't see anybody. No one texting. Vice Chair Smith, are you on the line? Well, I guess I'll ask his question for him. The one question that Vice Chair Smith has been advocating for is, I'm not too sure if one of you gentlemen know this, but is there, maybe you do, or maybe you could point us in a direction where we can get an answer? Apparently, there's a hospital out in the Sanders, Newlands area that was the clinic out there that was associated with Say It's So Medical Center out of Fort Defiance. Is there a reason why that facility is shut down?
Mr. Chair, this is Virgil Davis. All I can say, we can get an answer from the San Jose Medical Center, but I do understand that when COVID first hit during the month of March and some of the facilities started looking at their operational, I believe it was through the board of directors as well as the executive management team at Fort Defiance that determined that they would shut down the Naabik'iyati Sanders Clinic. So, but we can ask for more definitive information as to why they had shut down Naabik'iyati Sanders, and then we can also ask them what their plans are for reopening to address COVID in the Newlands area. I'm just speculating that's probably the reason why is that decision was made by board of directors and executive team from San Jose.
Okay. All right. Let me ask this question then, because I'm going to look through your documents here, but it seems like your Tuba City Regional Health Center, you're looking for $900 million. Yeah.
Yes, sir.
900 million, and I guess that's for a new facility, right?
Yes.
And then there's another. The other big ticket item is the Fort Defiance Indian Hospital, which is 131 million. Is that for an additional facility or building onto the Fort Defiance Indian Clinic?
Rachel, we have the answer to that. I don't have the document right in front of me, but I believe it might be in addition to the Fort Defiance, because I know that clinic is fairly new at this time. That for Tuba City, yes, we're looking at a brand new facility of $900 million, but this is a location that we added in that Mr. Davis had mentioned earlier. We have presented this to the Naabik'iyati committee as well before.
All right. Well, we'll take a look at this, and thank you for this information. It's good information. And I'm glad you got every one of them: Utah, Winslow, Tuba City, Pine Hill, Fort Defiance, and Alamo. Is there any facility that didn't respond to you guys?
Yes, we are currently working, Mr. Curley and I. We reached out to Sage Memorial Hospital and also to Canyon City Band of Navajos to also provide their information. And as of this morning, before we sent the documents to Donovan Hanley and Dr. Jim, we had not received any information. However, we did receive a call back from Sage Memorial that they had sent their information to Navajo Nation Washington office, Santee Lewis, and also to Dr. Jim. So we still have not received Sage or CBN, Canyon City Band of Navajos, but we'll be able to reach out to them again to see if they can still provide it, so we can add this as an addendum to our presentation and funding request.
Okay, with that, as soon as you get those two additional information, if you could send that over to Dr. Jill Jim and Mr. Hanley. Mr. Hanley works at the Speaker's office, and Dr. Jill Jim, she's on the executive side, so we're both relatively aware of that information.
Okay, will do, sir. Thank you.
Great. Let me go down. I do have an individual that wants to speak. Honorable Otto So. Mr. Otto So. Oh, there you are.
Thank you very much for the time at. Thank you very much. The healthcare facility, our 638 facilities, for the information that's being provided related to the expenditures and the expenditure plan. One thing I really would like for 630 facility to really expand on is to maybe beginning to start to partnering up with other healthcare providers, such as the healthcare that made a report to NABI this morning, or to this committee related to the prevention and testing and so forth for COVID-19, related to COVID-19. I know that the 638s are sort of in their own little silos. I'm not too sure if they have a sister, how can I say, sister healthcare other healthcares that they work with to try to provide the healthcare for Navajo. But in this case, I really would like for all 630 facility to start looking at partnering up with companies such as United Healthcare to try to assist with testing across Navajo. Instead of them coming to Navajo leadership and asking, can we do this and can we do that? But what I'm getting to is that the healthcare system is pretty much based off of the trust responsibility of the federal government. Yes, council gave you guys the authority to administer the health on behalf of the Navajo people related to go into the to opt into the 638 contract. But realistically, at the bottom line is the trust aspect of healthcare is something that we need to look at. And with these dollars that you have acquired from the federal government related to COVID-19, someone threw around $36 million. How much of that $36 million is going to be addressed to COVID-19 testing that these healthcare facilities are going to purchase? And for instance, earlier, United Healthcare indicated that they can come in and donate so many thousands of test kits. After so many thousands, they would have to go into a obligation. And this is our Indian dollars that these 630 health facilities receive on behalf of every Navajo citizen who utilizes Tuba City Health Care or Winslow or wherever. You know, for instance, I use Tuba City Healthcare Corporation. My Indian dollar goes to healthcare, to the Tuba City Healthcare Corporation. But I really hope that the $36 million, whatever piece of the pie that Tuba City is getting, that they are trying to go ahead and administer and try to purchase more test kits to test more Navajo, because Tuba City Healthcare Corporation serves a big service unit. And I really, really hope that's what you guys are looking at. And utilizing these COVID dollars. Not only looking at the Navajo Nation alone. I'm interested on how you're going to utilize this $36 million related to these health dollars that you receive directly from the federal government. So and I believe that should expand out to all the healthcare corporations. How are you going to utilize those dollars to try to combat COVID-19? So, yeah.
Okay, I don't know if anybody wants to respond to that from the presenters.
Yes, this is Virgil Davis. I can go ahead and respond with regards to Honorable So's question. We can go ahead and communicate with our 638 partners to ask them how they are setting up their partnerships and alliances in their respective states of Arizona and New Mexico. of how they are addressing COVID, but also I believe the prior request had indicated how much money have we received under CARES COVID funding. I think with that picture, I think we'll be in a position to provide a little bit more in-depth information with regards to funding that we've already received, what we're requesting, and then also how we are working closely with our partners. And I think that will give a broader picture as to how we are investing ourselves in mitigating COVID for 638 organizations.
Okay. Great. That, colleagues,
Daniel,
I don't have anybody else. Chairman Zoe, go ahead.
Thank you, Cecilia, Speaker, Chairman of the Naabik'iyati Committee. Other colleagues, other leaders in there, the case in there, other Nala, Mr. Curley, other Mr. Davis. I guess the main thing is perhaps a lot of the delegates are left speechless with the enormous amount of requests. Oshi Kwaja, Onan Sachadaja, your requested on to she done then. A job on says case or yeah. Nothing is not being meal and sagis and then. Koha the she. Hard. Allah the quaggy denoki. Oh, you to salute Ada. So she's on Nita. I see quaggy the Tadainos. Oh, your new construction. It's a long-term project. I see about the owner so response and mitigation to the pandemic. Quaggy. Could you Bonta case though late, huh? I see catch Mr. General just now no quaggy, honestly. He done it in these at ne. Oh, you do with Ada. She's in those Tado though. So she's this Ada. Could you Sato Nishaban see case he late out need to net a coverage and door me. As only the watering point. Quite ones are going at the jet only. Jay in this case, I got power line. Quaggy. As your window, please. As your response and mitigation does not mean new construction. For me, oh, Satoi Con specialist, the higher data, ne, in the la, Aggie. Oh, one go data is ne, the a king da cadole. Oh, you see, the Bahayadole. Argenta Casey, she been nation. Without any has the Kunde. But the main thing, I'll switch, is the fact that we were given some good overview, the legal Navajo Nation Department of Justice, as well as Office of Legislative Counsel, using the documents from U.S. Treasury as guidance ADOT's NHM, what Yago, ADOT's, is that what you folks have received to basically give you an idea of what the 600 million will be appropriate use of? We have requirements that are imposed by the U.S. Treasury Department. And that's what the council is going to be using. And perhaps you, the 638 Healthcare Organization, needs to be shown a copy of that guidance. So for me, I'd say rethink this. It seems like, we're trying to flatten the curve and you're trying to fatten the curve with all this money request. With Ada. Job, I'm Senado case. Speaker, Chairman, perhaps the PowerPoint presentations that was presented by Navajo Nation Department of Justice, as well as the guidance that Ms. Dana Bobroff, Office of Legislative Counsel, presented to the committee last week. Perhaps that could be shared with the 638 Association.
Yes, we can do that.
Yes, and that way, the organization has to realize that we're being told the money, the 600,000 expenditure has to be done by 12/31/2020. Of course, some of the stuff that you brought to the table, it's like it won't happen immediately. So that's my most basic response, and I guess I won't be open to any request until it's a reasonable request, not an exorbitant use of 3 times the 600 million requests. Without any thank you, Speaker. I'll go back on mute.
Thank you, Honorable Chairman. So that.
Honorable Speaker, may I address that?
Is there comments?
Yes, sir.
Response?
This is TMT that joined the line late. We understand there was some comments or some questions regarding Seattle Medical Center and the 45 Engineering Health Board. This is Jaron Prowse, the Operations Director for the Incident Command. Sorry for joining late.
Okay, hold on. Let me go to, is it Mr. Curley?
No, this is Jaron Prowse with the Incident Command.
But Mr. Curley, are you still on?
No, but this is Virgil Davis. I'm still on.
Okay.
Yes, Mr. Curley's still here.
Oh, did you have a response, or Mr. Davis?
Yes, I can respond to Mr. Davis and also add on to Mr. So. She has another response on your question, and I know that we did. Our true number is the number that we had put out there, 209 million, and with from all the 638 that we had received minus state and also I believe CBN. And so the notation of the 900 million was just something that we had presented before to Nabi and also 638, not the healthcare committee. So that's just an awareness out there.
Mr. Curley, Mr. Curley, you have to speak up. You have a lot of background noise in the background of you.
Okay, what about now? Is that okay?
Yeah.
Okay, so I was saying that our number of 200, our true number is 209 million, but that can also be narrowed down. We can sit down with another 638 again with the recommendation of the presentation from the judicial branch and also the presentation that was recommended by Mr. So. We can go back and meet with the 638, refine our priorities. This is a number that we want to start with, and this will be awareness that the 900 million is a need that for Tuba City Regional, that we're operating on a 45-year-old facility, and those are maintained by our facility grounds. And so that's just something to be aware of. Hopefully that we'll get some more funding down the road somewhere that we'll be able to secure some of that money in the future. So we know that that's not an immediate need. So we'll go ahead and go back. Mr. Davis and I can reach out to the 638 one more time and see what we can do to refine these numbers and narrow it down to what can be agreeable across all parties. Speaker. I don't know if Mr. Davis has anything to add to this.
Okay, Mr. Davis? I don't know, Mr. Davis, do you have anything to add? If not, who is the individual now that's on from Say It So Medical Center?
Good afternoon. This is Jerem Prowse, the Operations Director for the Incident Command over here at Say It So Medical Center. I apologize about calling in late. I wasn't aware of this meeting. I understand there was some questions regarding the Sanders Clinic.
Okay, yes. Hold on, is Honorable Vice Chair Smith on the line? Vice Chair Smith, Aging Vice Chair Smith. No, go ahead. So Browse, go ahead and we'll go ahead and whatever you have as an update, we'll make sure that staff's taking notes and we can get an update. There was an overall question about the Naabik'iyati Center, a clinic actually being closed, and there was just wondering why it was closed, and has the board or anybody in the upper administration stated when that facility will reopen? Those are the two questions.
I'll answer the first one. The reason why we closed the clinic was due to a safety concern to help contain the spread of the COVID-19. Once we implemented our incident command back on February 27th, we still don't feel comfortable enough reopening that clinic because we still need to put all of our control measures in place prior to allowing patients to show up to the clinic. We got to make sure that we have enough PPE to do so. We have started this week discussions regarding opening up some of our clinics to some of our more critical patients that need care. We have reached out to a lot of the patients that are at the Naabik'iyati service area, and we are doing telehealth for those patients so they can still get their care and are still being in touch with providers. So we just recently started those conversations. We started getting enough PPE to where we could start having these discussions, but we would rather have a 90-day burn rate for our PPE here at the main hospital and as well at Sanders before we do so. We still don't feel comfortable opening it because we are surging right now with our patients. We have a full ward of COVID-positive patients here, and with the events that took place over the Memorial Day weekend, we think that another wave will be happening within 2 weeks. So we don't have an actual opening date for the Sanders Clinic yet. We need to stand by and watch how the COVID plays out in the next couple of weeks before we reopen that clinic down there. And that's all I have for the updates for Sanders Clinic.
Thank you. Thank you for that update. With that, colleagues, any other comments, questions? If there's none, thank you very much again for calling in, and we look forward to that information as soon as, again, if you if one take Honorable Chairman Daniel So's suggestion, we can forward that information over to you regarding the expenditures and the parameters of the CARES Act, actually the CARES Fund, and what their dollars are eligible for and non-eligible or disallowable costs. We'll forward that information out to you. And also know that as of right now, as of today, there's a expiration date on these dollars that we have to expend them, as Chairman So indicated, by December 30th, 2020. And some of these bigger picture items that are in your presentation might want to be re-looked at. But again, if you get that information from Sage Memorial or from Hajile or Canyoncito Clinic, as soon as you get that, please forward that over, because we're taking all that information in, and my colleagues again will be at the end of the day, we'll be putting in and deciding where these dollars are going to be going in order to one, as we know from the public's response, is water projects was the most important thing, but the second important thing was healthcare and first responders, and getting more equipment out to our facilities out there. And that's something that's just in your neck of the woods with all your 638 facilities out there across the whole Navajo Nation. So again, thank you very much for presenting that, and thank you very much for presenting your, actually forwarding over your presentation to the 24th Navajo Nation Council Naabik'iyati Committee. Kat.
Thank you, Honorable Mr. Damon. We'll go ahead and do that. We'll go ahead and revise and work with our 638 and send out a new presentation to you as soon as we can.
Cool. All right. Thank you. That. Moving on down. Dr. Jill Jim, are you still on the line?
Yes, Speaker, I'm still on the line.
Okay, go ahead.
Here non-Kwadi presentation the leak didn't. I just wanted to say thank you to the speaker, also the 24th council members, and any listeners on the call here. I don't have a presentation, but I'm just going to present what we were asked from the president to present. And so, and the budget that we're submitting to the president is related to the epidemiology and contact tracing of the public health branch. And so that's a summary of the areas of development of epidemiology and pandemic response capacity, and also some support for first responders and public safety personnel are two items that will be addressed in the budget that we're submitting to the executive branch, and that basically includes our current org chart, which includes information about the contact tracers and more testing. Right now, there are areas that we're working on in regards to public health is the emergency operations. For example, under case management, we need contact tracers, and those contact tracers, we're looking at about a couple hundred persons, almost like the census. So at least 500 or more to do contact tracing. Also to do test coordination, continuing to look at expanding testing opportunities so we can kind of gauge when the pandemic is is decreasing, or where we're seeing more negative testing results in the communities, and to test asymptomatic individuals that are in close contact. So one of those we're running into is that we really have a shortage on testing. Some of the facilities that were needing testing recently was Tehoto Medical Center. We're trying to work with the state health departments to kind of consider not doing very large mass testings, but coordinating with the command center, but also supporting the supplies to the health facilities so they can coordinate testing for individuals that are both have symptoms or don't show symptoms but are in close contact. Although home support, there's a home support section of the public health branch, which includes cleaning supplies and services, and also isolation and quarantine are some things that we're already covering. But around a lot of this is in relation to case management and epidemiology to respond to the families and their kids or expanded families in the communities, and then around data management, and also just looking at expanding those. So the main request that we're looking at into the President's office is that we're going to look at contact tracing and testing supplies as one of our efforts, but there's also obviously some other areas that we haven't looked into and presented, but in collaboration with working with the Navajo Nation EMS, I know that we want to support their capacity. So I hope that you, the council, would hear from the EMS program as well. So, and that would just be my brief presentation, Speaker Kat.
Thank you, Dr. Jill Jim. My one question is, I know that the overall goal for this was this Naabik'iyati committee work session was to get a presentation from you, something in writing to say that, okay, when council starts crafting or putting together an expenditure plan, this is what we need. And I know that that's what you have said verbally right now, but is there any way that we could get a document or something in writing so that we can have that readily available and use that if we were going to say supplement it or create an appropriation fund or create the expenditure plan? We're going to have to use that as an exhibit in order to say that this is how we're going to fund it. We just can't utilize verbally. So I don't know if there's any way that we could get something, a document in writing on what you're actually needing. And two, I know that you conveyed a little bit on what the first responders are looking at right now inconclusive to your network there specifically. But I just want to let you know that my colleagues have had a overwhelming response from the communities on two big initiatives. And I think those two big initiatives are, how can we protect your workers out there, and what are they actually needing? And what I mean by the workers under your division is members of the Daltec community and members of your CHR community. I don't know if there's a plan in place or if there's something, and I know that those two organizations within your department are always talked about, and it would be really good to have a plan in place and any kind of appropriation or planning and progress in order for us to appropriate funding to those organizations, as well as the ones that are here that are staffed directly in Window Rock. But more importantly, the ones that are out there on an everyday basis, working together, helping our elders, helping our people, helping our community members out there at the local level. So I don't know if you have something in writing or if you will have something in writing shortly, but that's what we're really looking at in order to help you so that we can go ahead and make sure that you're getting every possible assurance and every possible degree of support that this council can give to you. And those are the documents that we need in order to make sure that at the end of the day, we're funding you right. We're funding you appropriately. We're making sure that we're helping our people out through your division. And I just want to know, is there a document that you're working on, or is there something that will be released shortly or today, tomorrow, in the near future, so that we can take this back and start discussing amongst us as a council to say that, yes, this is what she needs. this is what she needs to make sure that, one, her people are safe within her division, two, that she's protecting who she serves out there. And that's all those individuals that are out there, like the elders that your adult tech programs works with, like all the community members out there that are the CHR's visit, just making sure that we have all that information so that at the end of the day, we're not looking in the future, going back to the UUFB and asking for more funds for certain things. So that's what I'm looking at, and that's what I think the overall goal of this presentation was, Dr. Jill Jim.
Yes, Speaker. Here, quite teacher Heinz Ziggy, Ahansen do, Kehendini do, quite it's East Bahian, G quite beso not so the car additionally so the condition so do quite cheap staff taco do I just share the business addition store hate order quite not so sin kegi or the you just send it out link so she day what other she how she I send it out link so give me a couple of a day or so, and I'll follow up with Chief of Staff. Is that okay? Is that okay, Speaker?
That's perfectly okay. Good, and that's just the reason why is because we're here to help, and we're here to make sure that your department is going to get supplied. We're here to make sure that my colleagues on the council are here to make sure that your employees are going to get what they need. You guys are on the front lines right now. Every one of your employees that are helping out right now, whether they're essential, non-essential, whether they're just out there in the front lines, even just volunteering, whatever your department is the critical source right now in maintaining our goal in trying to get over this pandemic. And whatever you need, now's the time to express that to the council. Now's the time to say that this is what we need to do in order to do our job good. Not for just next month, not for the next 3 months, for the next year, for the next 2 years, for the next 3 years. These are our supplies that we're going to be needing in order for us to critically take care of our people and critically take care of stopping the spread of COVID-19 and possibly even into if there is what they might say in the future, a second or third wave, that we're ready and that your division's there to say that, yes, this is what we got and this is what we're needing in order for us to do our jobs good, correctly, and to the best of possibly the best possibly ability that you possibly can. So that I mean, if it takes you a couple of days, that's what I'm really looking at in order for us to get that information and helping each other out and getting us across that goal line together.
Thank you, Speaker. Yes, I'll work on Chief of Staff for that request. So, yeah, non-hidini on also, and
Okay.
We're here at the command center. We're here every day, and I know we all pray for our people out there, our relatives. So, good day, ni kato hada ni nil shindaya. So, yeah, non-hidini non yeah.
Oh. With that, colleagues, any comments, questions for Dr. Jill Jim?
Speaker, this is Delia Slater.
Honorable Slater, go ahead.
Thank you. Thank you, Dr. Jim. Do you have a picture of when we can expect a proposal from the administration on overall usage of the $600 million, or just for your programs? Now, at this time, could you ballpark a figure for us to consider, whether that's just your programs or any other picture you may have of what the proposal might be and what might be included in each appropriation? You've mentioned case management, and I don't think we've received a real written report that documents its genesis and where we're at today, like what each entity's responsibility has been, and really just having an understanding of how it's been scaled out to date, and how all of these resources are working together, both internal Navajo Nation ones and other entities like IHS or other federal resources. In regard to testing, is there a document or a plan in place for testing on the nation? And can we see where we're at on that topic? I just feel like there's a lot of scattershot information on different entities doing a drive here or a testing blitz there. But I want to know what the coordinated Navajo Nation response is, because I know that you're informed of these things and are coordinating it behind the scenes. It helps us get a picture of where there might be a flattening of the curve or not, and I think helps instill hope in our communities that we're getting resourced, we're finding out who's ill, and we can proceed forward with knowledge. So any information you can provide on that, I think really in written form, would be much appreciated by the council. All we can do is ask at this time. And on that last subject of the curve flattening, has the curve flattened? Is it flattening? I guess if you could help give the official line of where we're at as a nation, as the head of the HCOC, be much appreciated. And I want you and your staff to know that I, and I think all of our chapters, particularly the administrations, are thinking about them, pray for them, and we can't even imagine the burden that so many of people who, clocked in one day, and by the end of the day they were tasked into the biggest threat to the Navajo Nation in this century, and perhaps the last century. So thank you for everything you're doing. Yeah.
Dr. Jones. Go ahead, Doctor.
The Honorable Slater, for that question. We can do a report, a written form for your request around management testing strategies. I know that case management is fairly, I think, in its third week as a unified coordination group approach. We were doing case management individually at the hospitals. Public health nurses on lending. Case management unified coordination group Indian Health Service, tribal health organizations, Navajo Nation, asatin Danish Nahalanek Ade Estate Nahalon Kadi Danish trained at the training on us Keda Kadi Comcare Halgani Kadi iPad or phone be yet di Kadi questionnaires they go Hadi what they con halong Hadi Eladi and hit the neck Kadi the Kosantagi but that snuggy Kadi monitor the they on the referrals that they on Kadi a Comcare has gonna use a daily a what case management could testing the atleho kwadi zes in the do the mass testing do testing blitz palgani the kwadi hit the neck kwadi tested up at the ingo ashford that's a kwadi case manager again a kwadi the results the agent not has an engine auto agent hit the neck isn't the had the hit the that's not do or that's a bit no auto kwadi what best behind they be so that's the the question target that's a bit of the snaggy other resources other picture what they so hit the hell now the ACS site the alternate care site in the acquisition patients got in the hotel door tent kits they think then gay recovery kits the bedina there's 3 options or either they go to the hospital the whole purpose of case management is basically to identify a person that has tested positive and hopes that they get referred to in any of these other resources if they're eligible for it. There is an eligibility criteria to get admitted to the alternate care site, the isolation, and the recovery kits are really open to the person's preference. Just like the ins and the how shin za the shotten za the bas chinika di hon the has counting what is self isolate that's all yeah. So what case management not there is all the cases that are positive should start with the case management team and they're monitored and followed through. Although when they call our phone number, we're getting a lot of calls between non-COVID and COVID, so hopefully we can clear that up. But for the COVID-19, we oversee the individuals that are impacted with COVID-19 and their families and or high-risk individuals and elders. So case managers are out there. Those are all PHNs, CHRs, and that's why we need more people. So they're trained in case management. There's a coordination center here at the command center for those that are in taking calls and doing referrals. And we fill out the 213s to get food to the individuals or families or whatever resources they need. And then so the testing is very important, the testing strategy. We finally worked with the 3 states, or we're working with them. We met with them twice now. The mass blitz testing impact our numbers too, and we need more testing kits because there isn't enough. At some point, when we know we've flattened the curve or we know we're doing better, is that the more we test, the more individuals that come out negative is what we're hoping that we can gauge that our population is getting healthier or not getting infected. So there's a certain number of tests there. There's a testing I can't remember on top of my head how many testing we have to do per day in order to say we're sufficiently testing everyone. But with that is also a danger because if we test too much and we don't have contact tracers or case managers on the ground, like boots on the ground, to follow up with calls and resources and monitoring. We run into families that they're just asked to be discharged to go home and self-quarantine, and if no one's following up on them, they could have immediate oxygen issues without that kind of mechanism or support. So some of our hospitals, when they do these testing blitzes, sometimes they get like 90 positives or 50 positives. That means all those patients have to be followed up with, and that's where the recovery numbers are very important too. The more that we have case managers and contact tracers, we can have proper follow-up with them, and then that when they're all done and recovered, meaning they're no longer sick, we're able to get a better number on recovery numbers. That's very important that the testing, the case management, and the contact tracers are very important. And right now, there's a really high level of fear of the exposures that we had at the command center. We're really looking at how we're functioning here and getting more people to help us. And the only other route is to hire individuals similar to like census workers to get them trained and helping the nation with this response. And I think in our presentation to our submission to President, I think we had about, like I said, a couple hundred persons in that budgeted item, but that's kind of the overall framework. Is the immediate thing to understand is how we don't want to test because we want to know. We need to test in order to provide proper care and follow-up. And so that's our message to our state partners, is that we need to have adequate staff and making sure that we're prepped. If there's going to be a mass testing, we need to have, if a service unit needs help with contact tracing or something, they need to shift resources over there to assist them. So it's an impact, and we're learning. And so with some of the blitzes, that's what the aftermath is, that some of our areas weren't able to keep up with the case management because it became very overwhelming very quickly. And so it's very important that we get enough case managers and contact tracers. And then the last question around flattening the curve, I think it's starting to. The last couple of days, it's kind of gone down, the daily counts, but we're going that direction, but we probably have to sustain that for a good amount of time for us to say that. There are areas that are not showing increased numbers, and they're flattening in some areas like Tuba City area, but then due to their mass blitz, their testing blitz, their numbers went up again. So it just really depends on the blitz testing. We want to get a better control of that, and one of the solutions is to supply the health centers directly, and then figure out ways to target communities. That we can still do testing blitzes in the communities, but maybe more rural communities that can't go to the hospital. And so we need to keep that in mind. So it makes sense to still do some testing, but not in overwhelming amounts, but to areas that we can't reach, and we know that they have longer distance to travel to the hospital. So that's kind of our initial conversations. Some of these are on paper, but that's kind of our initial, my initial report on the flattening the curve. Thank you, sir.
Thank you, Dr. Jill Jim, for that.
Speaker, can I ask a follow-up real quick?
Yes, go ahead. Honorable Slater.
Thank you, Dr. Jim, and thank you for drawing that connection between the testing and the case management. I think the next extension is the alternative care sites, and based off of the data that the HCOC Unified Command Group review, is there a projection on like how many sites are going to be needed in the future, and what might need to be set aside from the $600 million to account for that? That's, I think, my only follow-up. Thank you.
Dr. Jim?
Yes, I'm here. So right now we have the 2 alternate care sites, and they're basically two sites here on Navajo, like the Chinle one. There's 50 beds, and Chiprock has 40. We haven't even made a dent in that one. So I guess the need would be based on the number of discharges that are happening. we're barely fully operational right now. So I think I would have to refer back to the ACS and isolation as we were dealing with ambulance services issues. But that was one of my mentioned earlier, was that maybe that can be a topic with them, that we could build our ambulance capacity. And so we're working with them. Navajo Nation EMS is providing ambulance services 24/7 at both of the sites to transfer between the ACS and the hospital, and they have to have certain certifications and requirements. So, but I can't really project that until we're fully operating, until we get awareness out there, because there has been some media information that has been sent out by the executive office, and then we have some handouts. So it really depends on how fast we can fill up these facilities, but there's also criteria that we have. And so our expansion efforts are still working with Navajo Housing Authority, is really supporting a lot of the costs or the wraparound services for those areas right now. So they play a major role in the ACS and isolation areas, as well as far as wraparound services. So they've been a good partner in working with us to get those items covered as far as expenses. So we appreciate our partnership with the Navajo Housing Authority on that note, but they're very expensive to operate. And so right now, there's a lot of federal assistance that are supporting as we're moving forward. Federal support is paying for some of those costs until we get our contracts in place. So right now, those are kind of the stopgap, which they call like short-term solutions to running the facilities. So we probably can get a better idea of what the operational cost has been to some extent for managing those facilities. The two facilities, they're the Army Corps of Engineers, cost around a little over $4 million. And the nation was either we pay the 25% or 10%. And so I think that will be, there's some costs and that we still have to pay for. And so those are just some items that I think are very important. And then as I'm being allowed to speak, there's other, I think, areas that will add into in consultation with the Chief of Staff and the President and Vice President. But the ACS sites are there. There's two. We're not even there to see how much we can fill those, not till we actually can get patients there. Then we can find out if there's a need to expand. And there will be future waves, like you're saying. Through the projections, I think the nation is expecting nationally there'll be future waves that we need to prepare for as well. Thank you, sir.
Thank you, Dr. Jill Jim, for that information again. Colleagues, I don't have anybody else on as messaged. Honorable Otto So, you're back on the line?
Delegate Crotty has a question.
Yeah, I'm on the line.
Okay. Let me go to Honorable Madam Chair Amber Crotty, and then I'll come to Honorable Otto. So, Madam Chair.
Thank you.
Okay. Thank you, Thank you, Speaker, colleagues, Dr. Jill Jim. Thank you for providing some insight. I've been reading in terms of best practices for community tracing for like communities that have limited resources. So looking at like the African continent and how they were able to deal with the Ebola outbreak. My concern is if we're, in terms of capacity, I'm concerned that we don't have a proposal for immediate needs. Is there a discussion, or maybe the council should look at other providers who can provide this service on the ground to complement? I'm thinking about how like for our uranium workers, they get a special type of insurance, and then they're able to hire home care workers, and it doesn't go through Navajo Nation. I think our biggest concern, I know for myself, in my region and the district I represent, is we kind of get this trickle-down effect from Window Rock, and what we're trying to build up is a more regional response. Can you give me an idea in terms of how that's incorporated in your proposal, so that we could empower the communities and not just solely rely, because if we're going to be hiring hundreds of community tracers, I think you mentioned maybe like the census, that's a huge lift to try to hire these individuals, and then who is going to supervise? I'm just trying to think in terms of Department of Health current capacity, and then how we roll that out to anticipate the different waves of not only COVID, but other health disparities that are out there. I'm seeing this as an opportunity to enhance regional health services. So can you shed light on how, because I don't have a proposal, I do have a concept paper, but I'd like to see a proposal from Department of Health. Thank you.
Thank
Dr.
you,
Joseph.
Yes, Speaker. Thank you, and thank you so much, Honorable Crotty. And I just wanted to say thank you for providing that information. And I think the concept under case management, we have several partners that are involved with training, which is included along with testing. Our current partners are Johns Hopkins, that are already here on the Navajo Nation doing other projects, and then also COPE has been involved with that. So I know that when we do partner with organizations like how to hire people or staff people, we do have the turnaround process could be a barrier in getting people hired. So I haven't had discussions with our team on the proposal, but if you do have something in mind, we would like to invite you to have conversations with the EPI team and under the public health branch to see if that would be something you would be willing to work with them on. Thank you, sir. Honorable Crotty.
Okay, great. Thank you for those suggestions and that feedback. With that, we move on down. Honorable Otto So.
Thank you, Speaker. Aron Jill Kenya. Ado Naabik'iyati reporting we have Navajo citizens out there who don't have transportation, and one contacted me over the weekend, and her husband works off the reservation, and the only time he gets home is on the weekends. So she's been trying to call social services. She got through to one, and social services said, "We can't help you." I know that's not under your wing, but that was Deanna Nesbitt-Gishi, but I'll address that with her. Then she went out to reach out to the CHR to the city. She just indicates that on the weekday that she is on foot, and so she gets her water during the weekend when her husband gets home. And I'm sure there's other individuals out there in her case throughout Navajo. I think we need to make sure that we do try to address those Navajo citizens who are in that capacity. Whether they are living in the underlying of a town area or in the outskirts. Maybe afterwards, I'll later on today, I'll send you an email to try to see if we could get someone to visit her and try to see what her needs are. I'll get you her phone number and her name. That way, you guys can have a direct contact service with her. I said these food drives and so forth that's supposed to happen and must be geared to individuals like you. But I'll go ahead and try to get that information to you. I don't relating to the virus. Really hope that you do have a budget to a proposal to submit to council for consideration. And I'm trying to but the indicate it's really diminishing pretty soon. I'm sure you're there doing your task with this enormous task that came onto the nation. That's all that I request. I should the other is that I believe that's all for now. But thank you very much, Dr. Jimchima, for making your presentation and coming to council.
Dr.
Yes,
Jim? I don't know if you want to go ahead and respond.
Yes, I will. Thank you for those comments, Honorable So. Yes, there are two sections of the Incident Command Center here under the Unified Coordination Group. There is the COVID-19 response, and then there's the humanitarian part that's currently being overseen by Harlan Cleveland. But if there are people that needs to be served that are not getting through, yes, we would help those individuals with reaching out to them and working our way through those as much as possible through the emails that you guys receive. I try to put those in 213s when I receive them as well. So even though there are the humanitarian part and the COVID-19, I think it's still our duty to respond to our citizens that are still in need. So just make sure that, Mr. So, I look forward to your email, and I hope we can help this individual that you shared with us or shared with me today. Yeah.
Thank you, Dr. Children. That, colleagues, I don't have anybody else has texted me or on the phone, but we look forward to those documents, Doctor. And that's something that we're really looking at in especially for your division, in order for us as the council to really define what we really can help you out with in order to be successful in your job and to help maintain that our I think everyone's goal, and that's to protect our people out there. And if and when if it's if we could get that information as quickly as possible, that'd be great. I don't have anybody else on the line. I don't have anybody else going forward. So, Dr. Jill Jim, I know that you have a lot of things going on your plate today. I know that you have a command center update, so you'll be at here in about 30 minutes. So thank you very much for taking your time out today for giving us those overall updates. I don't know if there is going to be an update from Mr. If we could get an update from Mr. David Nez. I don't know if he has a presentation too as well, because we did formally invite him to present to the council as well on what his recommendations were or what he's looking at and the immediate needs that he's looking at in order for him to get some of these dollars appropriated to him as quickly as possible there at the command center. So I don't know if you want to reiterate that information to him or if he's willing to come to present before the council, but we did invite him, but he has not responded back to our overall, I guess, presentation here at Naabik'iyati Committee.
Yes, Speaker, thank you for that comment. We will submit those items through Chief of Staff and the President's office, so I will mention that to him. Thank you, sir.
Okay, thank you. Again, we look forward to that information. That, colleagues, I don't have anybody else on the agenda right now. Ms. Yazi, do we have anybody else? Shazi?
Speaker, no, that concludes all the presenters for today. Shahan.
Oh, great. Okay, with that, colleagues, I think we had a good discussion today on some of the initiatives and overall goals presented. Tomorrow, we will be going in listening to the first responders. There is some presentations that were sent out by Chief of Staff and also by Ms. Hope McDonald Lone Tree. We'll be starting at 9 a.m. with our first responders, judicial and the justice system, Department of Public Safety, the judicial branch, and Department of Justice will be on tomorrow. Then in the afternoon, we're looking forward to listening to broadband. We had the executive office, telecommunications, and then also we have some other outside. My computer just died. What was the second one on there? We do have an update on those initiatives for broadband and tomorrow in the afternoon, colleagues. So without further ado, thank you very much for everybody listening in today. We will be, there it is, broadband tomorrow. Navajo Nation Cyber Team and the Office of Navajo Nation Telecommunications will be on tomorrow afternoon. So thank you very much, everyone. We'll go to the close of meeting right now. Is there any announcements this evening? It's a beautiful Wednesday evening. Everyone's
Speaker, this is Delegate Carol Newton.
Madam Chair, go ahead.
I just wanted to ask, was attendance done? I was on the Northern Agency call and I jumped on right after it was done, but I just didn't announce that I was on.
We just did an informal one just for recognition. So, but it's not formally recognized, Madam Chair.
Thank you, Speaker.
Okay. That, colleagues, any other announcements? Again, this is the plan going forward as of right now. Colleagues, let me just announce this. Tomorrow we have our Naabik'iyati Committee work session starting at 9. going through tomorrow. And then on Friday, it looks like at 9 o'clock in the morning, we'll be setting up here at the chambers to have a special Navajo Nation Council session. And that will be in person. We do have more than 13. Actually, there's 16 individuals that signed up for that special session as of right now. So that special session will be happening on Friday morning at 9 a.m. and that will be in person, colleagues. And then after that, we do have a Naabik'iyati committee work session, and that Naabik'iyati committee work session will be discussing our veterans issues and veterans updates, and then also hearing from the Veterans Advisory Committee, and then after that, going into listening to the Veterans Executive Director under the OPVP, Mr. Zwarline. So we look forward to that discussion, and then after that, I do believe that we'll be closing out the day with a report from Mr. Bart Stevens regarding some facility initiatives and some documents that we might be needing to work out with him in order for us to get some things done. So, colleagues, again, that looks like the schedule as of right now. If there's any comments, questions, please text myself, Chief of Staff, staff members here, but more importantly, stay safe out there, everyone. Hey, there's no one else on announcements. We'll go ahead and close this out at 4:35 p.m. Thank you, everyone, for calling in. Thank you to everyone for listening in. Thank you to the executive branch staff for calling in, and thank you to all the presenters, United Health this morning, to our Ms. Rosalind So, to you and your staff, to the 638 organizations. Thank you very much. And to everybody that's listening online, if you're on YouTube, Facebook, or Vimeo, thank you very much for listening in to these discussions on how your government's working towards coming up with recommendations to spend these dollars, as we know, as the CARES funds that was given to the Navajo Nation. Other than that, colleagues, if there's nothing else, we'll see you tomorrow. If not sooner, we'll see you on Friday morning for sure at 9 a.m. Going
in person?
In person.
Well, I got that's or not to associate with the Dallas Council delegates. You're too old, Mr.
Honorable Eugene So, you're more than welcome. We can have a coffee before you get here.
See you. Good day.
Good night. I'll see you. Have a good day. Safe travels, everyone.